Good, Chairman, we're live.
Is there anything you're bringing up today 4 or 5 times? I think I just let you guys know.
Okay, Tony, are we live? Okay. Good morning, everybody. Welcome to the staff meeting of February 23rd, I believe. Again, this will be a recap of our summaries of our budget seminars we had, and an update from Tim and others on the current vaccine world that seems to change daily. So I think it's important that we continue to communicate the best we can on the vaccines and to the media and the public. So with that, good morning, Commissioners. Thank you for being here again today, and I'll turn the meeting over to the manager, Tom Stoltz.
Good morning, Chairman. Thank you, Commission, for being here this morning, and thank you, Chairman, for kind of laying out the agenda. There's one other item that the Chairman forgot to mention. There's a legislative item that Mike Papoon and Akeem will talk about at the end of the meeting. So we'll go in order, budget discussion first, and kind of conclude the discussion we were having on Friday at NCAT. And then we have a multifaceted presentation on vaccine update. There's, as the Chairman alluded to, there's a lot of moving pieces there and a lot of change within the last week. So we'll get you up to speed on that. And then the legislative item will be at the end. So with that, on the budget discussion, I think what we had on the calendar for last Friday, and I'll let Lindsay chime in on this, was a discussion. We want to hear from each commissioner now, knowing what you know after 2 days of workshop. Kind of want to hear your priorities in a efficient fashion. So I think that the Chairman, we had calculated out at NCAT that, about 10 minutes per commissioner would be good. And that takes us to about an hour of discussion. So Lindsay, do you want to add anything to that before the commissioners get started, or?
No, I think I would like to add one thing, and that is just a refresher of what it was that we covered. So on day one, you heard the economic outlook from Jeremy Hill. He has subsequently provided quite a bit of content. He actually even provided more information yesterday, but I haven't had a chance to read through it all. So once I do, make sure I don't have questions, and I'll get that communicated to you, commissioners. You heard from Sheena Schmutz in HR about the compensation update, recognizing that we will have additional workshop to discuss that in April. You heard from Jim Weber about 3 very large transportation projects that are out there that will come to you in some form or fashion during the CIP discussion later this year. Then on day 2, you heard from Lorian about your financial forecast, which, while not fantastic, is certainly not the worst we've ever seen, certainly manageable. We talked about the target mill levy rate resolution that was passed back in 2016, and I urged some action on that. We also talked about the debt policy, and so Garth Herman from Gilmore and Bell was here to talk about that, and we do have some action items already promised on that. And then, as Tom said, we had planned to spend the last chunk of time that day talking through your priorities or any topics you would like us to bring to you, either in a workshop setting or through an issue paper setting. So I'm going to move up to the front of the podium here and take some notes on your priorities as you have your 10 minutes. Lorian's also here in the audience and can answer any questions or help us identify if there's some specific work we can do. So with that, I will come up there.
Okay. Okay, did you pass that back to us?
I surely did.
Okay, all right. Out of respect to the commission, we can go in any kind of order. If somebody wants to go first, I'd be glad to let's let anybody that wants to. We could go. Got a few things I'd like to summarize at the end, so I don't, if that's all right, if I go last, I would like to do that. Do you want?
Sure.
Okay. Okay.
I'll go first.
Thank you, Commissioner Cruz.
Okay, so I have a couple of items, and so I have really 4 main items here. And the first one is employee pay. Over the past 2 years, I've heard from multiple department heads around turnover of employees. Obviously, the workload this past year has been we haven't seen that before, so that's something obviously we need to take into consideration. But when a department head is almost in tears because she can't keep people, that really makes me think, how can we do something significant? Like, what are the changes that we can think of outside of the box to make sure that our employees are paid what they're worth? And I know that you guys are working on that, so that's nothing new, right? The other part of that, though, is the reimbursement for education. Now, this might fall under employee pay, or this could fall under mental health services, but there is a significant shortage of behavioral health professions and professionals in almost every area of Sedgwick County. So I wonder what initiatives are being developed to address this shortage. And so I'm looking for ideas, looking for ways to support, collaborate, to attract and retain talent, and develop the behavioral health workforce here. I know you guys are working on that too, but I just am going to say it. So my next topic would be mental health, obviously, substance abuse. Some of the facts and figures sitting on the Mental Health and Substance Abuse Coalition for the past 2 years. If we take these are sort of national numbers, but if we were to take them here in our community, we could round up some numbers. 19% of adults experience or have experienced mental illness. 9.7% of the youth in the U.S. are severely depressed. 10.8% of Americans with mental illness are uninsured, so we take care of a lot of those folks here. 40 million Americans ages 12 and older have substance abuse issues. 1 in 5 high school students have substance abuse issues. So that, I think some of those stats, especially the youth-oriented stats, show us that these problems are not going away. And so right now, in the time that we're in, how can we consolidate services in a location that are easily accessible? And so, with Tim and Joan and all the folks in ComCare and all the folks in our social services, can they shoot for the moon? What would they bring back to us if they could solve the problem? Knowing that it's a big chunk and a huge, huge thing to try to solve, and I don't know that it'll ever be solved, but we had WSU conducted a high utilizer study. So 519 high utilizer patients received $56 million in care. 30% of that, $17 million, was funded through public and uncompensated care and assistance. So how can we, out of those 519, those are just the high utilizers. So out of all the other folks that are here in our community that are utilizing our services, how can we get them back to buying homes, buying cars, being able to pay their rent? Here recently, my dad doesn't live here, but he was put in handcuffs and taken to the hospital. And I tell you that not for sympathy, but luckily, hopefully that isn't happening here in our community, but he needed mental health help. He's not a criminal. He needs behavioral health needs. He needs rehabilitation. And so I wonder, out of the people that we're servicing in our community, how many people are really receiving rehabilitative services? And I know that we're doing what we can, but out of our $450 million budget, what can we do to ensure that we have allocated those resources to folks who will need them? Again, getting people back to where they can pay their rent on time, those basic needs. Hopefully we can get them to where they need to be through through their case management services, through making sure they have medications, all of those basic things that maybe we don't ourselves experience, but we probably know someone who is experiencing a mental health crisis. Now let's talk about substance abuse. When folks in our community want to get off drugs and they don't have the resources to do it, they've made a decision, I'm going to get off whatever I'm addicted to today. They walk into our crisis center and they're told, we've set an appointment for you in 6 to 8 weeks. That person needs help right when they need it. They also need a medical detox. How can we fund a medical detox for folks so they don't have to get off whatever they're addicted to cold turkey? I don't know if you guys have seen any of those shows talking about substance abuse, but that's a really hard thing to do. And if we're able to provide that in an easily accessible place, I wonder how we could move the needle. For the past 2 years at least, I've been talking about this, and I wonder, I know that my colleagues have been talking about it too, and so I know that there is support. I know that I've heard each one of these commissioners talk about their support for mental health, and I'm absolutely grateful that we see that. But I wonder how we can really move the ball, like how we can put our money where our mouth is right now in this budget cycle to start really helping the folks who are most vulnerable in our community. So that's mental health and substance abuse. The other thing in sort of correlation to that is our ICT1 program. Bottom line is ICT1 continues to excel at treating people in place, preventing ER visits, preventing comm care visits. Now, the cost for this service right now, I think, is around $277,303. Now, that is a collaboration with our city partners, and I think that in turn, outside of the money it shows a good partnership between the two entities. 2 teams roughly would be $544,052, and that's a 7-day-a-week coverage. I think we know crisis in this community does not happen in the time frame in which the ICT1 service is provided. It happens at any time. And what we're doing is treating people in place so they don't have to go to the ER. We're saving those ER visits. We're saving our comm care visits and they're doing follow-up services for folks. Some of the numbers, we had 236 times a law enforcement unit was freed up. We see an increase in crime. And so if we're able to free up our law enforcement officers to deal with crime-related activities rather than mental health-related activities, I think we'll see a change. 122 times a fire apparatus was freed up. 165 times EMS was freed up. 523.99 resources freed up. I think while this program, ICT1, might not be an initial cost savings and it might cost us money, I wonder what are the resources, when we talk about bottom line, how can we determine the cost of this program in resources rather than the actual dollar amount that it's costing us. I think it's important to understand how we can change the way we look at service, the way we look at providing the service to folks that isn't maybe a traditional way. ICT1 is new. It's I think, what is it, in its 2nd year now, I think. And so it is relatively new. And so when we're looking at data, do we need to have a couple more years to see how it really is impacting our community? But I would be in favor of adding another team to that to ensure that we have 24-hour coverage for the folks in our community. Well, 7 days a week, not 24-hour coverage. And then finally, so this is my 3rd year here, and I am wondering how we can utilize a grant writer, a grant team of folks. With a $400 million budget, we have a significant amount of grants in all departments. And we could spend way less time maybe figuring out how to write a grant that would produce more applications. Grant writers, a skilled grant writer will bring sharper focus to each grant, which increases the probability of receiving that grant. Grant writing is really time consuming. It's detailed work. It requires extensive research. And sometimes maybe our staff is overwhelmed with other things. I'd like to hear from some of the staff who write grants. And I wonder, from what I understand, we have different grant writers in each department that are handling their own grants. So most grant writers that are specifically just grant writers are in the know. They know about all kinds of grants available. They can produce the applications, increasing the likelihood of reward. Having a consistent and gold standard grant makes Sedgwick County stand out among the rest, which increases our ability to maybe get those grants. And so having one grant writer, I don't know that it's going to cut it for us. But like, I had mentioned with our diversity and inclusion officer, they're not going to be able to do it on their own. They're going to probably eventually need a team of folks who are going to help them with this. But how can we utilize the money that's already out there that other grant writers are capturing for their counties? How can we get it to come to Sedgwick County? So not only just one, but consolidating all of those grant writers in all of our locations, in all of our departments, to have a sharper focus so that we can be sure to capture what's out there. So my 4 things are employee pay, mental health and substance abuse, ICT1, and a grant writer. Those are my things. Thank you, Chairman.
Okay. Thank you, Commissioner Cruz. Thanks for being very thorough and to the point. It was really good.
Thank you.
Appreciate your comments. Anybody want to go next? I'm looking around. Commissioner Dennis, thank you, and thanks again.
Thank you, Mr. Chairman. I appreciate it. And I appreciate what the staff did the last 2 days last week to bring us up to speed on what's going on. And we're only 2 days into this cycle, and we're going to finish it in August. So my comments are very early right now. We have not heard from any of the departments to find out what their basic needs are, and that's a big part of what will go into any decision that we make as we work into the final budget that'll come up in August. But to start off and follow on with Commissioner Cruz, we did receive a briefing on employee pay, and I think that that's important that we keep an eye on. The things that kind of came out that I'm not sure I've got all of the correct answers on. Employee, if you look at the big spreadsheet that you gave us, one of them, it talks about the average employee salary from 2008 to 2020 went up 17.8%. I need to know how that correlates to employees across the community and in private practice and so forth. So is that below where we should be? Is it above where we should be? I don't know. But when you also look at that and talk about costs for the employees, for example, health costs went up 74%. Pension costs went up 91.4%. Capers went up 66.8%. So I need to know where we're at based on where we should be when we consider all of the other benefits that an employee has here in Sedgwick County. Because as we've seen over the past year, pretty well the Sedgwick County employees and any government employees have had job security, which a lot of folks here in this community have not had. So we need to balance all that. So I probably need more information as we move forward with employee pay. So I think it's important, but I also want to make sure that we do it right. And again, I'm going to follow with Commissioner Cruz. Behavioral health is something that I've fought for ever since I came on board. And I've been down to San Antonio twice to see what their model is. And granted, we're a third the size of San Antonio, so we don't need something quite as large as San Antonio, but we need to make sure that we do start looking at what the solution is here. If we look at the last COVID bill where we got $99.6 million. As I mentioned at the time that we were being briefed that, I thought some of that money could have been diverted to solving some of these problems. But I think we used the money correctly because we were trying to make sure that we took care of nonprofits, we took care of small businesses, we gave out all kinds of things to help our community. But now I hear that we're going to get another $101 million possibly this year, and I don't know what the earmarks are going to be from the federal government on that. But I want to make sure that as we move forward, that this time we do take a look at what we need to do for behavioral health out of that $101 million, because I think it is that important. As we take a look at some of the other things that came out of the budget hearing, and again, since I haven't heard from all of the departments yet, I'm going to have some more comments later on. But our ending fund balance is something that really always concerns me. And if you take a look at another one of your long spreadsheets, it looks like we're going to have a deficit in 21, 22, 23, 24, 25, 26, and it's going to draw down our ending fund balance. And I appreciate the fact that previous commissioners left me a rainy day fund when I sat down on this bench, so that if we hadn't got that $99.6 million earlier this year, we'd have still provided services to our community. What I don't want to do is move forward and end up with a deficit every single year and draw that ending fund balance down so that we don't get to the point where we don't have a rainy day fund. If we're not looking at some kind of a bailout again with COVID relief or some other type of relief, we could be in bad shape. And I don't want my legacy as I leave here to be that I spent all of the money that was left to me by other commissioners, and they're going to be in trouble. So that concerns me. The other thing that we have not heard yet are what is the impact of other projects that we've got coming up. We know Odyssey, for example, is coming up. That's just one that I'll use for an example. But it's going to impact us as we move forward. So there are a lot of little projects like this, and that's not too little, honestly, that is going to impact our budget as we move into August. So we're going to have more information on all of the things that we did not hear about yet that will impact us. And as I spoke during the budget hearings last week, we need to take a look at our debt policy and make sure that we get that revised. And we need to take a look at what our mill levies policies are, and take a look at reviewing those, and look at some targeted funding for certain departments to make sure that they have the wherewithal to move forward. So, as I said, I'm sure that there are other things that are going to come up that are going to be priorities for me in the future. But right now, just looking at the big picture, because that's all we've seen so far, I'm not going to get down to individual items at this point in time and tell you that it's a priority for me, other than making sure that we don't run a deficit. Thank you. Appreciate it.
Okay. Thank you, Commissioner Dennis. That was, again, very, very nice. It sounds like, I'm pleased that it sounds like the commission is pretty prepared with their comments, so very helpful. Commissioner Howell? Okay. Thank you.
Well, thank you, Mr. Chairman, and thank you for the chance to raise issues and concerns. I think this is very good for this commission to do so. I just want to start out by saying I think that the county commission needs to define our purpose. One thing we've not talked about recently, I know we have a mission statement, but it's fairly unconstrained, I would say. We don't know exactly what our limits are, because I guess I'm concerned that there are a million things under the sun for us to focus on, and we can't solve every problem out there. And I know, as much as we might like to try, we have to know that some things are not in our wheelhouse for us to fix. I'm afraid that we we get pulled into stuff that we probably shouldn't get pulled into once in a while. And I don't know that we can solve every problem. I think that right now, with all the things we've heard about today and the last couple of days, for us to really meet all of the needs that have been presented would absolutely be a huge tax increase for our people. And I guess I have to say that I'm very concerned that I think would be very regressive and very hard on our community if we were to simply say we have to raise the funds and we're going to go provide these services, and this end up being a tax increase for the people we serve. I think that's out of balance. And so I guess I'm very concerned about the cost of government. And by the way, I do want to say, Lindsay, I want to say appreciate very much the bottom of the sheet that you gave us the other day talks about the cost of government, and the cost of government actually is lower today than it was going back to 2008, in terms of if you take a percentage of your income and you see what how much of your income goes to paying for county government, it's actually a little bit lower today than it was 2008. So I want to make sure everybody knows that. That's actually really good. But we can't speak for every government that's out there. And you start adding in the state government and federal government and school boards and everything else, I think the overall burden of government actually has gone up. We don't really know those numbers, but I'm concerned that this seems to be, an ever-increasing government footprint when you look at government overall. And I don't want to be a part of that necessarily if we simply don't have constraints on ourselves on what problems are our responsibilities versus problems that simply we want to get involved in and fix. So, for example, I know that one of the commissioners has raised the idea of using some of the problem gaming fund, for example, to help deal with mental health. And I think that's actually not a bad idea. Unfortunately, the states also looked at that very same fund, and they've used it to balance the budget. So, and now there's a proposal to use expanded gaming, online gaming, and things like that would go to fund. That would actually, and also marijuana, legalization of marijuana, would go to fund Medicaid expansion. I just think that we don't know necessarily if that's a net positive or net negative for this community. We need to be very, very careful, and I just think we need to understand that just because there's a pot of money out there doesn't mean that we ought to necessarily go and connect those dots. There may be more challenges that come with those ideas than a solution that we would actually think is good. One of the mission creep things, again, I want to just be upfront. I do support initiatives on mental health. I think it is a problem for this community. I've not been involved in as many conversations as some of my colleagues have been, so I feel like I'm coming in from behind a little bit. Some of that is by design because some of these meetings are not really open to everybody. Sometimes they are, sometimes they're not. But I don't feel like I've had the same access to some of the same data that some of the other ones have had. And unfortunately, I did try to go down to San Antonio. My mom died the day I was supposed to get on the airplane, so I wasn't able to make that San Antonio trip. And I would still like to go down there and see what's going on. But with respect to mental health, I see there's two things out there that are competing, at least in my mind. One of those is the ICT1 program. I think we need to be very, very careful to understand how successful that is. We need to be very objective. But let's understand we have a zero-sum game of dollars, and if we want to find other ways to spend those very same dollars in maybe more effective ways, we need to have that conversation. I think that, for example, mental health campus is something we've talked about for a long time. And I think that those dollars, unfortunately, we need to figure out which is the biggest bang for the buck. If we had only a certain amount of money, what would we want to spend it on? And by the way, I appreciate the comment of previous commissioner that talked about adding a second ICT1. In my opinion, that's just still a drop in the bucket. I think to really expand that program to what this community needs would probably be about double that, if not triple that. So you start adding up the dollars that relate to that, you're getting into millions of dollars. And I think for millions of dollars, you have other options as well. We need to understand the the choices we're making here. I'm very concerned about the high attrition rates in some parts of our county. I know there's a temptation to say it's all related to money. I don't know that it is. I would like to see us do something to help us understand this better. I know we have exit interviews to some degree. I mentioned this during the financial retreat. But I think we need to invest in having some third party provide that data, or I should say capture that data, interface with those employees that have left and those that are choosing to leave, to develop, if you will, a report to the commission to find out why people leave. I don't think we have a good understanding as to what that is. It's not always about money. There's other things that are going on. And I think that obviously we do need to pay our employees appropriately, of course, but I think that pay needs to be viewed as not just a paycheck, but needs to look at the entire package. I've talked about personal time off. I've talked about long-term and short-term disability program. I've talked about moving from a CAPERS 3, which in my opinion is a wet blanket. I know it requires legislation. I'll say that up front. We can't just do this without legislation, but I do think that CAPERS 3 is a wet blanket. It doesn't really help us attract or retain employees that are in that program. We can certainly do better. And there may be some other things we ought to be looking at in the private sector. We compare ourselves with other governing bodies that are very much like us in terms of traditional pay programs, but I think there's a lot of things happening in the private sector. If we really want to be competitive, we need to understand that. And we have not heard much about that. The pay study we did hear about, they focused on salary only. A year ago when we talked about this, we raised this issue, and they said that that was a, if I remember correctly, it was basically a deficiency in the report, but they agreed that is a factor that we need to understand, and I don't think we understand that yet. I may be alone when I say this, but I think our EMS program, our EMS organization needs to revert back to its previous organizational structure, where OMD and EMS are separate. They work together. The EMS needs to have a director, and OMD needs to be on the side of EMS. They need to work together to provide those services, but I don't think that'll be put together. I think we need to study that and go backwards, in my opinion. So I'll just throw that out there now, because it maybe it might have a financial impact. And I am curious. We were presented on the long sheet, our CIP proposed. I'm not happy that I don't think that's enough for us to go forward. I'd like to know on this list which items are new, which items have been on there for some time.
And Commissioner, we can provide that to you. This is the list from the 2021 adopted
Okay.
book.
All right. Well, thank you for that. I know there's always a lot of discussion about CIP that goes on. I think we need to be more involved in that a little earlier in the process, I guess. I'd like to just reiterate, I agree with the idea of investing in problems before they get bad. You know, when I made a choice to run for county commissioner in the first place, there was an issue of Judge Riddell Boys Ranch that was going on. It was very political. And I think anybody who would look at that would say it was highly political. But the idea was we were going to help solve these problems on the front end. It was expensive, but it was less expensive than incarceration, which where a lot of these kids will end up. And so we saw this as an investment in these youth. And so I think that there is a truth to that. We need to understand if it's beneficial to this community to invest in these programs on the front end. And I think mental health is exactly like that. We need to have a better understanding exactly what we're investing. And I believe as a conservative, we can say we invest those dollars on the front end, we'll save money on the back end. But I don't think we have that data. That's my problem. So I guess I'd like to ask for better data on that. And I guess finally, I would say, we talk about mission creep and responsibilities of the county. I'll say it one more time. The aging mill levy is a mandate. We have a mandate from the people to fund aging programs, which are service programs for the elderly. A mill levy should be dedicated to aging, and I think the Aging Advisory Board needs to have some ability to steer those dollars. Right now, the Aging Advisory Board doesn't seem to have a purpose, and the way things are going right now, there's probably not much reason for them to meet at all. All they do is receive information. They don't have the ability to steer policy in any way. And I think that's not good government. When we have a mandate of the people, and we simply have not made that part of our normal process here. So I'll just say that, and that's probably too much. Thank you, Chairman.
Okay. Thank you again, Commissioner Al. Commissioner Lopez.
Okay, thank you. Well, I guess number one, mine is going to be the pay compensation for the employees at Sedgwick County. You know, I've had the kind of unique opportunity to just meet with all the department heads, and the one thing every single department said was they just can't keep employees because of the pay. And I feel like we spend so much more money training people and then having them leave to go somewhere else that pays better, hiring again and training people, that if we just paid, a more competitive rate, that we wouldn't have to have those same costs associated with it. Behavioral health care is obviously a really one that's really important to me, and even ComCare said the same thing, that the one thing that would help them the most would be to be able to retain their staff, and pay would encompass that. But obviously healthcare is that's the biggest piece, I think, to me, is mental, but also public health. I mean, this last year, we've really seen what happens when public health isn't funded as well as it should be. I know that's a national thing. It's just everywhere. Public funding or funding for public health has really been cut. And it's one of those things where in a normal time, a lot of people just don't see the importance of it, and then they cut that. But then when we need them and they're not there, it's a huge loss to the community. And I think we can invest a whole bunch in all these different fun things to do around town, but if we can't ensure that our community is healthy, it's just not going to be worth it. I think the number one thing we need to do is take care of the people in our community first. Behavioral health care is a big part of that too, substance abuse. When I knocked on a lot of doors last year and talked to a lot of people on the south side and made phone calls, and that was the biggest thing I heard was mental health, substance abuse. I mean, we talk about addiction being a problem. Meth is terrible on the south side. So I love the idea of a campus, but I think we need to have other places around town for, easier access for other people. And I think substance abuse, a rehab center would be amazing to get for the people on the south side, obviously for everybody, but to have it a little bit more convenient for them as well. Investing in healthcare is something that it is more expensive up front, but it pays for itself long term. And the frequent flyers, working at a hospital, we would see the same person repeatedly, and just for that one person, the costs they're huge. And so if we could invest that money that we're spending there anyway into helping, on the front end, I think that helps more people. I think it saves money. I just think it's, more responsible as far as finances go. But my last big thing would just be the technology at the county. Technology is one thing that I think it's overlooked by many if they haven't worked in technology before. It can help make things more efficient. It saves overhead cost. It makes our staff happier when they have easier processes to follow. And that's another one, just like with healthcare, that you pay up front, but it pays for itself overall. So I think the county can really invest there in a way that maybe we haven't as big before, where we are saving more money long term, because right now if we have different applications for every single department and we pay maintenance fees for every single one and servers for everyone, we have to upkeep. If we can kind of bring some of that together, that's a huge savings, and that's what many private sector people, businesses are doing, because that's the way that just makes the most sense and is most effective. So I think that's another big one that we should look into. Thank you.
Okay. Thank you, Commissioner Lopez. There's been great things said. I kind of follow along with what Commissioner Dennis reminds us, that we've got a whole, months ahead of the details of the process. So some of the weeds stuff has already been addressed, but one of the things that I'm still supportive of us continuing steps on functional fire consolidation. I do like the discussion about the problem gambling fund that maybe can help. I know right now it goes into the general budget, but if it would go into some kind of dedicated fund for supporting substance or mental health issues, behavioral health, and maybe part of it could be, again, supporting that reserve that we've talked about before to keep interest arena, kind of keep that for the future of, so again, just maybe a discussion about it. I'm a fan of, I'd like to see, maybe if it's a way, Lindsay, if you could, all this mental health and funding that we're doing, it might help. We've got our regular budget, but how much, you throw ICT1, you throw all those things together, ComCare, public health services. I don't know if there's a way we can just have one number that's maybe broke down so the commission can have a feeling that, okay, of our general budget, look at how much we're spending towards that. Might be helpful. And then I am obviously a fan of ICT1, and if it's worth expanding, if some of the experts feel that the cost benefit is worth expanding, I'm very open to that. I am supportive of at least what we do now. I think it's had great impact. And so, and then we've got a facilities challenge coming up this year for sure with our departments, but that's just on our radar. If I could just, you don't have to write this down. This is, in reflecting on this, it's been a year ago when this COVID stuff hit us all. And the stress that it's caused community-wide, but the stress that it's caused on each of us commissioners, of our leadership, of our staff, I mean, it is so noted and somewhat overlooked sometimes. The emotional things that are said. I mean, we see the emails we get that are just not normal times. They have accusations from people and good people that are maybe saying things that they would never intend to say. So if you recall, this COVID was only supposed to last, a month or two, and then 2 weeks even started. And then summer was supposed to, the heat was going to kill the virus. Well, all that did was accelerate it. And then during all of that, we had this tremendous pressure on testing that we had to go through, and we were ramping up, and then throw in $99 million to spread in a matter of 7 months with that committee and that stress. It just pointed out to me that there was just an endless array of stress, special meetings. So on the staff, the commissioners, leadership, it ended up affecting relationships between ourselves, relationships between commission and leadership, relationships between our homes. We each had our own home and family and friendship stress. So I refer back to the hospital calls when, and I think Commissioner Lopez has probably real life witnessed it, but to hear the stories of the nurses that are, the last contact before somebody passes is just heart-wrenching. And so we didn't have that kind of life and death stress, but we've had a lot of emotion around here. So now we're in the vaccine world, and the exhaustion and the impact that it's had on all of us. I just want to recognize that and state it publicly. And it's not I'm not more exhausted than either of you all. But as we go forward in this year, I think we're on the downhill side of this steep mountain, and I'm pleading for us as a commission to try to remember the respect and dignity between especially our leadership with our our county manager and attorneys and their immediate leadership, as well as all the employees. If you're listening, if I've done anything that I need to apologize for, I do apologize. And but I feel passionate about this, and I just think that as we work through this, we try to remember Each of us have our hot buttons, and each department has their needs and wants, and each citizen has their needs and wants, as each citizen group thinks they're the most important to be vaccinated next. And I think we just need to, as I'm doing right now, take a deep breath, count to 10, and we're in charge of 500,000 people. And I just want to stress, I want to thank everybody in the county, employees and leadership, for what they've done without days off, without vacation days. And I know we've talked about try to take days off, but most of them say I can't because it'll be double the work when I get back. So that has nothing to do with the budget, but it does maybe help set the tone for the next few months as we plow through all this. So that's my plea, and it's heartfelt from me. And thank you, commissioners, for the best we've done in this past year. And let's hope we can get to I support the budget process that we've been doing. Lorian and Lindsay, thank you for all your work. So with that, I don't have anything else other than that was my preaching from the pulpit. So thank you again, commissioners, for sharing all of your thoughts. And it's really helpful, I believe, for you all, Lindsay. And okay.
Thank you.
So, you got any closing comments, Lindsay? You want to say?
I don't think so. Lorian gave me thumbs up, so she's satisfied, and we took good notes, and it was well presented. So thank you, commissioners, for that guidance. And we will, what we'll do now is move forward to work with department and division heads throughout the organization to hear what their needs are. This year, we hope to do, like we've done in years past, we'll have a little bit of a rehearsal with them before we come back to you in April-ish or so to kind of just go through the next portion of the budget. There will be a workshop already scheduled on employee compensation, which we talked about last week. Sheena and WSU will be back in most likely early April to workshop that with you. And I'm not so sure we shouldn't have a workshop on mental health. I'm hearing enough across the spectrum today that it is a complex topic with a lot of moving pieces and probably deserves its own workshop. So we'll look to schedule that as well before we get to department and division head call-outs of budget. So now let's shift gears and talk about vaccines and COVID. Let me just kind of, before Tim hits the podium here, let me just kind of talk about where we're at today and plans moving forward a little bit. When vaccinations started being discussed in a national level, the CDC came up with and began to define, and we're talking September, October, the 4 phases of which the vaccine would be administered. This CDC document was embraced and adopted by the Kansas Department of Health and Environment. So our KDHE partners at the state embraced this, and our own local health official, Dr. Mins, also embraced this kind of concept because we knew going in very early we were not going to have 3 million doses of vaccine to do a mass vaccination event, which is what we have practiced historically around Sedgwick County. How can we vaccinate 500,000 people in less than a week? And we had a plan for that. This was not going to be that way. Our county health staff, along with emergency management, developed the Sedgwick County vaccine plan. Here is the iteration for January 12th. There's an iteration about every other week or so on how this evolves, but they came up with a plan. And a plan that involves a vaccination which is not just a county issue. It is not even a state regional issue. It is not even a national issue. It is a global issue. Everyone in the world needs the vaccine. And that is something that just a pandemic of this nature brings to the table. It's a highly unusual, the once in 100-year, hopefully, kind of event. So as with COVID, and Chairman kind of prefaced this in his comments, from the get-go, there's been shortage. there was a shortage of PPEs. We couldn't get hand sanitizer, we couldn't get masks, we couldn't get anything in March and April, and we worked our way out of that. We couldn't get testing. We worked our way out of that. And now with vaccine, the final chapter of the book, we're having a hard time getting vaccine on a national front. It's not just Sedgwick County or state of Kansas issue. So we got, just to kind of go over the recent history, because it seems like we've been doing this for years, but it's only been a few weeks. We initiated phase 1 just before Christmas, according to this plan. And that was all medical workers and doctors and nurses and optometrists and other people that worked in that field. So that was 2 days before Christmas, December 23rd, Sedgwick County began to vaccinate phase 1. We initiated, and it seemed like forever ago, but we initiated phase 2 1 month ago yesterday, on January 22nd. We started with phase 2. We consulted with the CDC and with KDHE and Dr. Menz, and the decision was made that this county was going to emphasize elderly people. When we talked about this very early in June last year, when I first heard Pfizer had a vaccine on a fast track, we started talking as a staff about the importance to get it to our elderly and our compromised. That is the mission here. And as this came into focus in December and January, with discussion with Dr. Menz, his focus was 2 items and a third periphery. 1, let's stop the death. 2, let's try to relieve our hospitals and their ICU overcrowding. And 3, when we can, let's try to stop the spread through vaccination. So that's been the plan going in. That's our plan today. It's our plan until this board, which has the authority to change it, changes it. That's the plan moving forward. So currently, we're serving elderly population. We pivoted last week because the governor of the state of Kansas came in and emphasized K-12 teachers, which was a group of phase 2. So we pivoted last week. We're getting extra vaccinations, and we have plans in place, and Tim's going to go through this in his presentation, to administrate vaccination to all K-12 teachers and staff, and that's a population of about 16,000 in the community. About 3/4 of that want vaccine, so about 12,000, 13,000 people we're looking at here. We're pivoted and moving on that this week, continuing to service our elderly 70 and above right now. Hopefully soon, within a few days, go to 65 and above. So that's our plan. Okay. Our plan is also, and we've been clear even from November moving forward, that this was going to take a series of weeks and months. And you'll hear me say this, and I know you've said it as well. Not everyone can be first. We have to prioritize based on health, public health standards in medicine. So as we all get emails from people wanting their group to jump the other groups and be first, we stay strong on our plan today, which in Sedgwick County is elderly first, and now teachers. And Dr. Menz will visit with staff this week. We'll visit as a health staff and look at what's going to be next within these work groups, and it will be based on medicine and best public health. That plan will be brought back to this board, and you will hear it, and you will have access to Dr. Menz, and you can question him on it, and you can change it if you want. But he is going to come forward with a plan on how we've moved when we get past 65 and aboves, what employee groups, what work kinds of related groups should be vaccinated next, understanding not everybody can be first, and this is going to take a series of weeks and months. And we're going to show you some modeling in a little while, depending on how much vaccine we get into the community, how long this could possibly take. So with that, let me have Tim come up and kind of give you the current status of numbers, and specifically talk a little bit about school vaccinations, and then we would probably stop at that point and take some questions.
Okay, Tom, don't see any questions right now. I think we're all looking forward to hearing Mr. Kaufman.
Good morning, Commissioners. Tim.
Good morning,
Kaufman,
Tim.
for the
Welcome to
record.
the meeting.
Thanks. Within the past week, we vaccinated 5,077 people with their first dose. 3,170 people got their second dose. So that's 8,247 people were vaccinated Monday to Monday. So those numbers include yesterday. We have we've delivered a total of 38,612 doses. 12,608 of those doses are second doses, so those folks are now considered fully vaccinated. And we have moved our process to 223 South Main. Our current status, again, as Tom mentioned, we're vaccinating people that are age 70 and older and healthcare workers. This week, yesterday was our first day at 223 South Main. We had a reduced schedule. We didn't open until 3 o'clock, but we had a very successful day yesterday. The process worked the way we liked it. A family friend of ours happened to get an appointment yesterday afternoon. In the evening, she complimented our staff and the process that they went through to get people vaccinated. So we're very pleased that the things that we learned while we were in Trust Bank Arena translated to the new location, and we're very happy to do that. And we will be, as we get more comfortable in that setting, adding additional appointments so that we can get our numbers up even higher. So that's where we're at. Now, as we look at where we're headed, much of what's going to happen, Tom mentioned already about schools. We were developing plans to work with partner organizations, including pharmacies and some other clinics, to dispense vaccines that we receive here in the community. And Tom talked about the pivot that we had to make because the governor late last week made an announcement that she expected health departments to focus on K-12 teachers and staff, and provided some additional vaccine to make that possible. So we've had staff spend a lot of time, health department staff spend a lot of time talking to school district staff about how we can make this happen. And there are roughly 10 school districts within Sedgwick County, and then there's the Catholic Diocese, and then there are a number of private schools. And we've been in contact, we think, with all of them. We've contacted 17 different private schools in addition to the 10 different districts. And as I mentioned last week, we will customize the response in each of those districts and groups to meet the needs and the capabilities of those schools and some other partners. So there are really 3 different models that we're going to use to vaccinate school staff. One is going to be a transfer model. So Sedgwick County will receive the vaccine, and then we will transfer it to an entity that has been approved by KDHE to dispense vaccination. In most of those instances, that's going to be a pharmacy, or it's going to be a clinic. Potentially one of the safety net clinics will be doing that. So we'll transfer the vaccine, and along with the vaccine, we'll transfer the accountability for the vaccine. And so that entity will be responsible for inventorying the vaccine, cold storage, the cold chain management, and documentation of the vaccinations that they do. So that will become the responsibility of the partner that we transfer vaccine to. And in most of those instances, that's going to be a pharmacy, and pharmacies are familiar with managing medications and doing vaccinations. So very familiar work for them. And so local pharmacies have partnered with school districts, and they're going to take care of that responsibility for that school district. Another model that will and that'll be about half of the school districts that we're working with will be that through that transfer model. Another model that we'll implement is what we refer to as a partner point of dispensing, or a partner pod, POD, point of dispensing. And in a partner pod, we're going to share responsibility with multiple entities as we go through this process. So usually it's going to be involvement of another entity's vaccinators, so staff, it may be school nursing staff, it may be some pharmacy staff, it may be, in one instance, we're going to work with a local EMS, and they'll do some of the dispensing, but we'll be responsible for the cold storage management. We will be responsible on the back side for that documentation, so the data entry, but we'll partner with somebody else they'll provide some vaccinators. And so it's less of an impact on the health department. We still have to help with registration. We have to help with the management of the vaccine and then the documentation, but we don't have to pull staff necessarily away from pull vaccinators away. And then the final model that we'll use is what we call mobile pods. And so when we do a mobile point of dispensing, we're going to go out into the community, and we've already started to make arrangements with some facilities across the community, much like we did with testing. We took testing, not only did we do the mass testing site, but we also did testing throughout the county, and we'll do something similar with entities where we'll take our staff and take them into another location different than our mass vaccination site, and we'll do some localized vaccinations. And so we'll use that same model now in some schools because they may not even have the capacity to help really with vaccinations. And so we'll provide the management of the vaccine, we'll provide the vaccinators, so the dispensers, and then we'll also take care of the back end, the documentation, and making sure that everything gets accounted for. And so those are going to be smaller entities. We're going to try and group schools together if we can, particularly some of those private schools. The numbers are much lower at the private schools, so it makes sense for us to try and group those together. And if we can find a partner that's able to do some of that vaccination, we'll certainly do that as well. But as I said, we've been in contact with all of the school districts that touch the county. We've got either very detailed plans, or we're in the process of developing those plans with the school districts. And we've got vaccinations that will begin in schools, I think, as early as tomorrow. But there's going to be a lot of vaccine that gets dispensed to school staff this week and next week. And our goal is, again, to get everybody that first dose within 2 weeks or within 3 weeks, and there's a possibility we'll get it all done within 2 weeks because we've had some additional vaccine come our way. The other thing that's helped in accelerating this process is that some of the pharmacies in some of the suburban communities have vaccine available, and so they're partnering with the school, and so we may have to just supplement a little bit of what they've got through this special allocation that we've received for our K-12 teachers. So we have made a lot of progress in the last 4 days since the governor announced this plan, and I think we're in good shape to be able to get our school staff vaccinated in a relatively short period of time without having a significant impact on the mass vaccination clinic that we're operating. So I think those were the highlights that I wanted to hit. In terms of there are two other things I need to mention. In terms of the school vaccination process, we have the vaccine that we've been allocated, the 3,500 doses that the governor set aside for us, is going to be Pfizer, and so that's why it's really complicated to manage. Most of the folks that we're going to be working with don't have that ultra-cold storage capability. We also have some additional Moderna vaccine that's coming in that will probably continue to work with USD 259 because they have the ability to manage that, and they've got a very good process too. They went through the vaccine, the 1,200 vaccine doses that we had transferred to them over this past weekend, and so they've got a good process in place too. Everybody that's able to do that sort of thing kind of relieves pressure on the health department, allows us to continue to focus on the work that we're doing now at 223 South Main. And the other big change, in addition to the location change, is that by the end of the week we will be scheduling second appointments for people that come in for their first appointment. While they're there, we'll go ahead and schedule their second appointment. There's been some confusion. We give people a vaccine card and we tell them that either the 21-day or the 28-day date after which they should schedule their next appointment. Some people don't understand that appointment has to be scheduled, and so we're going to try and handle that scheduling of the second appointment while they're there receiving their first dose, and so that should start this week. So that's another process improvement that we're making. We've got staff that are monitoring what we do all the time in our vaccination clinic, making changes on the fly. Yesterday I went to visit. They had been open for about an hour and a half or so, and they'd had some folks that are specialists, they're public health specialists, that were observing things, and they were making some recommendations so we could make some minor adjustments to get people to flow through a little bit more quickly. We're doing that sort of observation and adjustment all the time. So I'd be happy to answer any questions about any of the things I've covered. If not, Tom's got a really cool demo on modeling.
Okay, a couple questions, Tim. Commissioner Dennis?
Thank you, Mr. Chairman. Thanks, Tim. I appreciate the update. I've been over to the clinics 3 times now, and I've been very impressed all 3 times that I've been over there with what's happening. And I understand that several of us will be going over again Friday with Senator Marshall to tour once again. So I appreciate what you're doing. The other thing that I am thankful for is that 2 of the priorities that I think this entire board has is to get kids back in school and get people back to work. And by vaccinating the teachers, we certainly are accomplishing the first task because we can safely get the teachers back into the classroom. And it actually helps with the second priority because those parents that are staying at home with their children because they are not in class now have an opportunity to go back to work. So I think that's working great. Couple questions though. Assisted living, I don't know that we've ever gotten a good answer on where we're at on getting assisted living vaccines.
We believe that we've been in contact with all of the assisted living centers in the community. What we discovered was that many of them already had an arrangement with the CVS or Walgreens, and those that didn't, we've made arrangements to get those folks scheduled and taken care of. So I believe that that issue's been resolved through one of 2 different methods.
Okay. Another thing I know that you need are volunteers. Every time I go over to one of the vaccination clinics that we've got set up. My question is, my wife, for example, is a retired registered nurse. When she retired, she didn't renew her license. She's going to have the second vaccine here on March 6th, something like that. And she'd love to help out. But from what I understand from KDHE, excuse me, that they don't allow people that don't have a current license to give the vaccine. It doesn't compute to me. She's given thousands of vaccinations and shots in her life. I don't think that people like that would be more than qualified, and we've got a pool of people that are ready to do that. What do we have to do to go to KDHE and say we've got a pool of people and we need them to help?
You know, that's an interesting question. We will certainly raise that with KDHE and ask if there would be a possibility that they could suspend some of their current regulations for this time period. But we'll take that question up to KDHE.
Good, I appreciate it. The next question I have, if you take a look at some of the stats that you've given us, we've given 30-some thousand vaccines already to people. We know that we've tested an awful lot of folks, and we've had 40 or so thousand that have tested positive here. So they've got antibodies. In addition to the 30-some thousand that Sedgwick County has vaccinated, the hospital's been given the vaccine. We've had long-term care facilities are giving the vaccine. Pharmacies are giving it, and we don't have those numbers. We don't have any idea total number of people in Sedgwick County. I think as the Board of Health, it'd sure be nice if we knew the total number, but we don't, unfortunately. But I would say that right now, and we don't know how many people have had COVID that did not come and get tested or were asymptomatic and now have antibodies. So I guess that's a long prelude in the fact that I think probably we've got at least a fifth of the citizens in Sedgwick County right now that have antibodies. And so as a result of that, 2 things. One is that we don't know the scope of who has antibodies. And we're giving a great test over at a number of places around the community. But there is another test. And I understand the WSU has the possibility that when they get a sample of someone goes in to find out if they're positive or not, that they can also tell whether or not that they've got antibodies. I think we need to have that second piece of information from those tests that we're giving on how many people have antibodies right now so that we know the scope of how many people are protected here in Sedgwick County. So I'd love for us to explore with WSU to see if when they get a sample, if they can do 2 tests on that sample, 1 to find out if they're positive and 2 to find out whether or not that they've got antibodies. That gives us a good piece of information. Also, with all of that information that I've just talked about, with the possibility of a fifth of the people already having antibodies, and I think it's showing up from our numbers because right now we had 2 goals at the beginning, is to keep people from getting COVID and to keep people out of the hospital so that we didn't overwhelm the hospitals. If we look at the numbers in the hospitals right now, they're not overwhelmed. We're green. The other thing we're finding is we're down around 5% positivity rate, and that's something we've been shooting for all along. So I think that it is time that we also talk with Dr. Menz about loosening the restrictions on businesses and getting businesses back open. As I started this whole long dissertation, I said we had 2 goals: to get the kids back in school. We're accomplishing that, and get businesses back open. I think we can accomplish that also. So those are my comments right now. I appreciate it. Thank you, Mr. Chairman.
Thank you, Commissioner Dennis. Commissioner Cruz? You're not on. There you go.
Along with Commissioner Dennis's question about antibodies, can we, when Dr. Menz comes, could we have him maybe talk about how long those antibodies last? If that's something that's even, I just need to learn more about it, and I'd like to hear it from him.
Sure.
And then if that is something that we'd like to consider, say they last longer or they're effective, how much is that test to add on to the regular COVID test at the molecular lab? So those are my questions around antibodies. The second question I have is also kind of long-term care facilities. So is there a way to get a definitive answer as to whether we've hit all those? I mean, I know you said that you're kind of sure, you're kind of not sure. I just wonder, you are sure about that? Okay. So we've contacted all of those?
We've been in contact with all of the long-term care facilities, and they have either participated in the Walgreens CVS program, or we've scheduled with them to get them taken care of.
Okay, thank you for that clarification. The third question I have is around the mobile pod. So in addition to vaccines, are we still doing mobile testing?
I believe that we are, yes. We've got sites on the website. We have scaled back some of the schedule that we test at the Extension Center. We've shifted those staff over to vaccines, but we're still doing some mobile testing as well.
Okay, I just want to make sure that those who don't have transportation are able to maybe get to those sites if that's something they need. The second part was the point of dispensing. You said that we're going to share responsibility with those that we dispense to. You also mentioned that we would be doing the data entry, but wouldn't both folks have to do data entry? We would have to give them to them. They would have to then determine who they're administering it to. So I guess I'm just concerned with the shared data responsibility. Since data is so important, how can we ensure that, the numbers... That's just a concern that I have. You don't necessarily have to answer that, but, and then finally, the doses that we're receiving, well, I have 2 more questions. The doses that we're receiving, so say that, and I know that we're going to do the modeling here in just a second, which is great. I'm excited about that. But say we're receiving 7,000 doses a week or whatever the number is. Are we vaccinating first shots of 7,000 people? Or are we cutting it in half at 3,500 so that we're reserving the second shot for those people?
We're receiving, there are 2 different doses, different lot numbers. It gets pretty technical pretty quickly, but we're receiving about 3,500 first doses, and that's what we're scheduling at about 3,500 second doses.
Okay, so the 7,000 number isn't necessarily, so I wonder if there's a way to communicate it so that we can talk to folks in terms of how many people are being vaccinated per week rather than the doses we receive, because when it is kind of confusing when you say we've received 7,000 doses, but you got to cut it in half automatically. If we're not sticking it in 7,000 people's arms each week, it's only 3,500. I wonder if there's a way to make you look confused.
Well, no, I'm not. Tim has gone over first shots and second shots. So 28 days ago, we had people getting first shots of Pfizer. Today, they're getting second shots of Pfizer. So if we did 1,200 people 28 days ago, today, 1,200 people should be scheduling second shots. That's why some of the data we're trying to provide you on a daily basis, and we can continue to massage this and make it clearer. But there's first shots and second shots, and that when we get 7,000 doses in, we have to make that go to both populations. So to your point, it is inaccurate to think that we're taking on 7,000 new clients every week. We surely are not.
Okay.
We're taking on probably about half of that.
Okay.
And then the second half of those doses, so if that number goes to 20,000, that's 10,000 new clients we can take on, but we've got to administrate second shots.
So we are reserving those shots because we're not confident that we're going to be receiving those next doses?
I think and I'll let Tim, and Adrian's on the phone here as well. I think with Pfizer now that we are confident enough that we're going to get a stream in that we could begin we know we're going to get that. Moderna, I think, and I can be, either one of these can correct me, Moderna, not so much. We have high freeze capacity here in Sedgwick County, so they have earmarked us for Pfizer because we have the capacity to manage and administrate it. Many other jurisdictions in the state of Kansas, most other jurisdictions do not have high freeze capacity. So to answer your question, I feel like the Pfizer stream is enough now to where we can plan on getting 7,000 doses a week.
Okay.
And the 7,000 that we receive are 3,500 new doses for first doses and then 3,500 second doses, because based on the shipment that we received 3 weeks ago.
So I just want to eliminate confusion when we have folks going to the portal. We've said that we've received 7,000 vaccines this week, right? So you go to the portal and there's no appointments.
Yeah.
And so I think it is kind of confusing when we're saying out there that we have this many doses, but that's not necessarily how many doses we're giving this week of the first dose.
Correct. Of
Okay.
the first dose.
So I've been trying to explain that, and it's a little difficult to understand. And then the last final question is, so when Dr. Menz comes and he talks about the high critical contact workers and how now that we have, gone through our elderly population, and then maybe he's going to be discussing about comorbidities, but then the folks after that. So I'd like to just kind of squash the law enforcement. There have been some rumors floating around that we're vaccinating Sedgwick County folks rather than Wichita PD. And I just want to make sure that we're communicating exactly what's going on with law enforcement. Maybe we're not even there yet. What is the standby list? How does someone get on that? Those are some of the really important questions that I've been asked that I just want to make sure we talk about right now. And maybe Dr. Menz is going to be talking about that, which is fine. But what date will we be talking about it, and how can we address it if we can right now?
Let me take a shot, and Tim can pile on here. We're going to have a visit with Dr. Menz this Friday about our elderly population, how we're doing, and then begin to identify the other work groups in phase 2. We're also going to visit with him, to Commissioner Dennis's point, about the existing order and the numbers and what we're seeing, and whether he is interested at all in modifying the order, or if we're going to just wait till the order extinguishes. So that's a conversation for this Friday. In answer to law enforcement, the answer is no, we are not to them as a group on phase 2. Very early on, and the schools are going through this now as well, when you vaccinate, it is critical that we don't waste a single dose. So we have created I don't know if standby list is the correct vernacular for that, but we have created a list of people that you can call at the last minute and come get the shot. Schools, all of these school districts that Tim described are part of their strategy when they get ready to vaccinate for the day, is to have a list of people or have somebody come in and end up with 3 or 4 doses at the end of the day, shoot the doses so that they don't expire and we don't waste them. So they will come up with their own list of people. It could be as simple as a spouse or another staff member or whoever they can get their hands on. We don't want to waste any vaccines. We created such a list when we opened the mega site. And we knew, we looked at phase 2 and we saw law enforcement, public safety in general. It's past police officers, it's police and sheriff, corrections. We have court personnel, which you consider public safety. And so we compiled the list, and it's about 400 names deep of people who wanted the shot, and that is a mishmash of WPD, county sheriff, I think Hayesville Police is on there now, some court people, corrections, Glenda's people. But at the end of the day, we end up with very few doses. They're shaving this very close to use the doses that are appointed for. So when you call an appointment, we're down. There's many days we have 0 left over. So that list is moving at a snail's pace, one here, one there. And I don't know that one group is any more emphasized to the other. It's whoever's available to come down and get the shot so we don't waste any. So when you hear things like, well, you're doing some county employees and not others, that's not necessarily true. We'll look at whoever's on the list and whoever's available to get 1 or 2 or 3 shots in at the end of the day. But as a group, I've got a corrections director down there that asked me yesterday, hey, when are we up? When are we coming? Because they're working with, just like the sheriff is, a population every day. And we understand, and I appreciate her going to bat for her people, but we are not doing them as a group at this time.
Well, I think that's important. I mean, if I could just take that little clip of you and send it to folks. I think there's a lot of just misinformation. It's a heightened emotional time, as the chairman has mentioned, and everybody wants it. And so I think the more we can communicate the reality of what's really happening rather than what people are kind of floating around, that's really why I kind of wanted to
I
address
understand,
it.
Commissioner. In addition to this meeting, every Tuesday, we try to get you guys down into the weeds and get you up to speed. We're trying to provide a daily report for you that's meaningful and has the kind of data that will help you answer those questions as you get them. And then yesterday, we started kind of what we did back in March and April with a kind of a media update. So we're going to do that Monday, Wednesdays, and Fridays, I think at 3. Okay, so in the afternoon. And that'll be streamed, recorded, and it's actually live with media. So we'll try to, the way to relieve stress, I was having a discussion with one of you yesterday about this. The way to relieve stress is good communication.
Amen.
And the more we communicate, the lower that. And people may not be happy with us. They may not like the order we're going in.
But at
Nobody
least
wants
they'll
to be
know.
first, but they'll know.
Okay,
So.
great. No, and this email that you sent yesterday was really great too. Thank you for sending that.
Okay. Thank you, Commissioner Cruz. Commissioner Lopez.
Thank you. I had received multiple messages over the weekend about volunteers, and I feel if we are asking people to volunteer their time to be around hundreds of people a day, that they should not be waiting until the end of the day to hopefully get one of the shots that are left over. I had people tell me that they've volunteered a couple of times. They were told, hopefully you'll get one today. They didn't get one. They're not coming back to volunteer. And I have people who want to volunteer, but they just feel so uncomfortable going. I just think if we're going to have volunteers, we need to make sure that they're getting vaccinated as a priority and not as an afterthought. Is there a way to?
We are reviewing that process right now. One of the issues related to this vaccine is that there is an observation period tied to it. And so that's one of the reasons that we've had people wait until the end of their shift before they were vaccinated so they can be vaccinated and then go through that observation period and make sure there's no reaction. What we don't want to have happen is someone come in that we're counting on them to do some role throughout the course of the day. They get vaccinated, they have a reaction to where they don't feel good enough to finish that shift, and then we've got a hole in our schedule. So that's the rationale that we've used so far, but we're reviewing that, and we think that by the end of the week we'll have a more clear process related to that. But we want to make sure that people are available to volunteer that shift, and that was the thought process there.
Would there be any way to do it before that, even before the shift, the day before or something? Or if it's going to have to be at the end, can we make sure that we have the vaccines available for them? Because I just don't see how we can ask people to come in if we can't guarantee that they're going to get a vaccination.
We're certainly looking at all of that.
Okay, thank you. When will we start the mobile clinic for vaccines outside of schools? When can we expect to see one in Clearwater or, whatever the case may be?
My guess is that we're probably committed somewhere between 5 and 6 weeks to get the teachers resolved, to get that issue taken care of. So it may be after that. But the other thing that we're working on right now is, again, in anticipation of additional vaccine coming into the community. Once we get the vaccine that we need to operate our vaccine clinic on South Main every week, we're going to be transferring vaccine to other partners in lots of different settings across the county. So there's pharmacies in particular, but there's some other safety net clinics that we'll be working with, or we'll transfer vaccines so that there will be more distribution points across the county besides our vaccine clinic.
Okay, I would like to see if we could get the data on who's been vaccinated so far. Just the geographic data of where they live in the county. Is that possible?
Adrian's on the phone here. You mean my zip code? Kind of
Yeah,
like we
by
just
zip
played?
code, that would be
Adrian,
helpful.
you want to address that?
Hi, Adrian Burns, Sedgwick County Public Health Director. We can definitely get that information, and we do have some on the story map, but I will get with staff and see just the degree of specifics that we can get to now that we have vaccinated the amount of people that we have.
Okay, and can we also get a list of what pharmacies are going to receive doses from us?
As we dispense, as we transfer, we'll include that information in that report.
I just want to make sure that some of our communities that might have a harder time getting to places, they're going to have someone in their community, and that we're not going to ask them to get out somewhere else where it might be easier for people who don't have that problem. If those are right next to them, it just seems like that might be kind of a problem to look at. So I'd like to see that if possible.
One of the challenges that we're going to face is that we've got, I think, over 80 pharmacies in the community that have been approved by KDHE. And so, again, until we get a significant amount of vaccine in addition to what we can use, it's going to be hard to dispense that out.
Sure. And do we know, after we get finished with schools and we're receiving that extra allocation now every week, will we be able to keep that once teachers are done? Like, are we going to be able to use that for our community next?
We don't have that commitment yet. I mean, I think that all of us are hoping for that, but we don't have that commitment right now. What we've been committed is to take care of the teacher population, school staff population.
Okay. Well, I would just say I'm so happy to see our schools starting to go. I went to the USD 259 clinic on Saturday, and they had it set up so well. There were no problems with line movement. I guess when they first started, I saw a couple of things, but they fixed it right away. I spoke to the teachers there. I mean, there were a lot of smiles and tears of joy, and it was just a really great experience to see that. And I'm going to try and hit the majority of the districts just to check in as they're doing this to make sure that there's nothing that they need, and if so, then I can kind of communicate that back to you guys as soon as possible. So just kind of want to say thank you for all the work that you guys have put into this. I know that those teachers and staff have been really appreciative of everything. And my last thing is just with Dr. Mins, with the meeting on Friday, when you say we are having a meeting with him, who is we? How do we, what group?
That is health staff, the manager staff, and legal staff.
Okay. Is there any way we could get on that? Two of us? And I don't know if you want to do that in public, but.
Of course, if we had more than two of you, then it becomes a public meeting. And I don't know that Dr. Mins, this is where we make sausage basically, and we talk through scenarios, and we ask him a lot of questions based on what we hear from you all, and then try to come back with answers, or have him come back with answers. So let me
Okay.
give that some thought, Commissioner, and
Okay.
we'll try
Yep.
to do what we can.
Okay, that's all I had. Thank you so much.
Thank you, Commissioner Lopez. Commissioner Howell?
Thank you, Chairman. I'd like to go back to testing is my first question. I'm looking at the website, and it talks about, for example, today's dashboard says there's 406 people tested in Sedgwick County, and there's 24 new cases of COVID. There, on one of the other pages on that dashboard, it shows the case count as an accumulated graphical display, and that's really good for that. Where can I go get the daily, unless I want to go backwards and find out what the number of people tested was per day? Is there a place to get that data?
On the rolling average, you can pick that up. If you want it by day, if you go to the Kate, if you want to go to the,
The rolling average talks about positive cases, and then there's also a bar graph, but you have to go to every single day and click on it to find out the number.
right.
Is there a place I can get that data more simply than that?
I'm sure staff could pull a report and get it to you.
Okay.
What's
well,
the
I'd like
ti-
to-
what's the date range that you'd like?
Well, I want to go back to at least probably October, because I want to see the high point of our percentage buried in that data. Number of people being tested, the number of positives we had in each day. And our number's down around 5% right now, but anecdotally, I'll just say this. It seems like there's a lot less people being tested now, which is interesting. And that, again, the positivity rate by itself doesn't make a lot of sense, because 95% of the people being tested are getting negative results. But the reality, if you're only testing 400 people in a day, whereas before we were testing 3,000 people in a day or whatever it was, sometimes we were testing 1,000. I think it's relevant, if you went by numbers, saying when we were testing 1,000 people, if you only had 24, that number is much, much smaller than it would be going back. And there was even a time when we were only doing we were doing symptomatic people, which actually drove that number a lot higher. So I guess I'm just trying to wrap my brain around, I guess, some of the history of this. But I think actually, because our testing rates have dropped significantly, I think, right now we're showing a 5% positivity rate, but really, if you consider the higher rates of testing we've had in the past, our percentage really might be much lower than that. I don't know. I want to be able to drill into that data a little bit better. So, okay, back to vaccines for a little bit. Let's talk about first responders. I assume we've gotten all of our paramedics and EMTs to provide first responder care from ambulances. Have they all been offered the vaccine?
They were the very first group that was vaccinated.
What about firefighters?
If they're certified as an EMT, then yes.
I believe most of our firefighters are certified EMTs. Just, if not all of them, I think maybe they all are. Is there any?
I mean, remember, we're talking countywide too. It's not just county fires.
I understand.
City fires.
So we're talking about other fire departments like Derby and Mulvane would have been offered as well?
Yes.
If they're in Sedgwick County? Okay. So, but the EMT was the critical piece of that. So if they're EMT, do we have any police officers that are EMTs? I don't know if that's even a thing.
That'd be very, it would be.
If they are, then they would have been offered the vaccine.
Okay.
It was the EMT status that
Okay.
earned them access.
I'm looking at a website called kansasvaccine.gov, which apparently is what Kansas uses to actually display their policy on vaccines. And we continue to say we're following the state's guidelines. A couple of things about this I think are noteworthy. On phase 2, for example, it says examples of groups included. It says firefighters, police officers, first responders, and correction officers are all the same. It's the same sentence. And right below that is grocery store workers and food service. Then below that is K-12 child care, K-12 and child care workers, including teachers, custodians, drivers, and other staff. And it goes on down from there. Now, I'm supportive of the idea of our K through 12 staff getting vaccinated. I agree with Commissioner Dennis. Getting our kids back to school is a huge part of this economy. And I think we've got to get those kids back to school. And I support that. But it's interesting to me that if you follow this list, they have the same priority, maybe even a lower priority than firefighters, police officers, and first responders. First responders we've identified as paramedics, EMTs.
Actually, the EMTs that were vaccinated as part of the healthcare worker.
Right, and I agree with that as well. And they're up above, up on phase 1, shows healthcare providers. So we're able to get to the paramedics What about the EMTs that are on ambulances? Were they also part of that as well? Phase one? Okay. Do we know what percentage of our sheriff's officers from Sedgwick County have received the vaccine that want it? Do we have a percentage?
How many that want it?
In other words, out of all of our sheriff's deputies that are commissioned law enforcement officers that are out there in
The
out
sheriff-
there interfacing public, what percentage of them
The
that want the
sheriff has
vaccine?
provided a list of deputies and detention deputies who would like to have the vaccine, and it was hundreds. And to date, of what we have done as far as no waste policy down at the arena, it's a fraction of the group that wants it.
Okay, I guess can we try to get that number? I'd like to
Sure,
know the
I mean, it changes
percentage.
daily, but I'll get you whatever we have.
Just get a
today.
snapshot, that'd be great, because I've heard some data I'd like to know.
Comment about the disaster declaration and the impact on the school district.
Another one of the things I think is curious is the veterinarians industry has reached out to me. They said according to KVMA, that's their association for the state, apparently there's only 2 counties in the state that have separated the veterinarian groups from the Phase 1B category. 103 counties out there have allowed veterinarian staff to be part of the Phase 1B rollout. But Sedgwick County and Potawatomi County apparently have chosen to not do that. And I guess if we're following KDHE guidelines and CDC guidelines, why are we different than the rest of the state?
Were they phase 2 or phase 1, Commissioner?
Phase 1B, according to KMVA, which is their organization for the state. They were Phase 1B.
Veterinarians have been one of those small subset populations that have moved from category to category. My recollection is that initially they were in phase 2 or 3, and then at some point in time, they were moved into the 1B category.
One of the things that's hard for county commissioners, I don't know if my colleagues agree with me, is when there seems to be an unfairness that's out there, when one county does things differently and they say they're following state's guidelines and we are different, and I have no way to explain that. I find that troubling policy-wise for us to have an entire part of our population that in other counties are getting vaccines because they're part of a higher priority on this phase list, then we don't recognize it here. It's problematic, and I can't reasonably answer those questions.
The
I find it
answer
troubling.
to that question is, other counties, particularly rural counties, seem to have greater vaccines per capita than the urban centers do. That's a problem. So when you, and I get the same kind of calls, when you get calls saying, well, but over in such and such county, they're vaccinating XYZ, police officers, for example, or teachers, but you're not. We don't have the vaccine total per capita that those small rural counties seem to have gotten. So our plan is elderly, and then now teachers, and that's the plan. If the commission wants to change the plan, the commission can. Just tell us who to move to the front of the line, and we will do that. But that's the answer to the question, Commissioner. We just don't have the vaccine numbers to accommodate and make everybody first right now.
Okay, so, phase 2 is a big group, and I agree when you're talking about an age qualification, moving from the older part of that population down to the younger part of that age band. Okay, I get going from 90 down to 65, that makes sense to me. But phase 2, let's talk about this. Are we planning to offer vaccines to everybody in phase 2 that's age qualified before we get to things like police officers? Is that our plan?
Our plan is now, with what Dr. Menz presented a month ago, is let's get elderly done first, and elderly is defined as 65 and above. We pivoted last week because now teachers were brought out of the group and into the focus by order of the governor, basically, and getting extra vaccines to do that. The commission has brought up comorbid people who are maybe not of age 65, but who are in cancer treatments or dialysis. Maybe we should look at that, and Dr. Menz is analyzing and studying that based on what the commission wanted. So that's the plan today. But we have to get through the 65-plus population under the current plan. The current Dr. Menz recommended, KDHE recommended plan is to get through the plus 65s and then go to the work groups.
Okay, so let me just say, I agree with, taking our allotment of vaccine and being strategic with that. I guess I would rather, personally, if I had the ability to help create policy, I would divide that out and say 2/3 of it goes to people that are age qualified, and 1/3 of that's going to go to the other parts of the sector. Let's start drilling into the other parts of this phase two, because I think the reality is we're not going to get everybody who's 65 and above before we start going out to everybody else in that. There's a lot of categories under there, and I don't know that, to me, it just seems like, I mean, on this list, they're co-equal on this list. I don't think it's indicated that these are priority listed. It doesn't say that the thing is on the top of this list is more important than things on the bottom of this list. They're all co-equal. So I just think we need to start solving the problem by providing some vaccine to some parts of that industry. And I would even challenge the industries themselves to promote within their own organizations those that seem to have the greatest needs. In other words, if you are, a police officer, but you have had, medical problems in the past, perhaps they ought to try to move that person up in their organization to the top of their own list, encourage them to get the vaccine before others that are healthier than they are. I guess for me, I would rather see us peel off a portion of our vaccine and move to other parts of phase two. And I am very much a fan of the comorbid thing, but let me just say the comorbid is a very broad category. I'm not saying everybody that has high blood pressure should be part of that group. What I'm saying is people who have stage 4 cancer that are dealing with chemotherapy and radiation, they're very, very fragile. Some of them have a 50-50 chance of living, or maybe even worse. And for them to be offered this vaccine, to me, it just makes. If you're trying to find the most vulnerable in your population, surely they've got to be on that list. To me, it's almost common sense. But yeah, we're not even going to get to them until phase 3 if we follow this guideline, and I find that troubling. So again, I don't know that comorbid is the right word, but I like the term medically fragile. You know it when you see it. And I think that there's people out there that are very, very fragile that should be included. Right now, phase 1 and phase 2 that we're going out to, we're hitting a lot of folks that really aren't medically fragile, and they're being offered a vaccine ahead of people who are very, very medically fragile. So I think it doesn't make sense. I would just simply say President Biden has talked about 600 million doses by July. I was assuming he's talking about the end of July. Just give him the benefit of the doubt here. That's for the second dose. When he says 600 million doses, that's for every American to have 2 doses. And we are here now at the end of, getting close to the end of February. So we don't have a lot of time between now and if you back off a month of that, at least a month before that for people to get their first dose. That's June. Between now and June, we should all have our chance to get our first dose, according to what he's talking about. I don't know that we have the capacity to manage those numbers in Sedgwick County. When we're doing 7,000 doses a week or 8,000 doses a week, we are not prepared for what's about to come at us. We've got to do some other planning. I know there's some discussions about using pharmacies and other clinics. I guess I'd like to see that defined more crisply and presented to us so we have an idea exactly how we're going to handle those higher numbers. And again, finally, I guess my final number would be this. I agree with Commissioner Dennis. I think it's, I'm not sure what the right word is, but it's unethical that we're not getting roughly 18% of the state's vaccine here in Sedgwick County. I don't know who's making these decisions, but we're only getting 7% or 8% of our vaccine for the state. That's not okay. I don't know if we need to do a resolution and present it to the governor, but we need to do something to make sure our words are being heard. It's not okay that we sit back and get 7 or 8% of the state's vaccine when other counties are way ahead of us, and I don't know what to do about it. But I think we need to step it up a little bit and do something that's a little bit more, I guess, to register our opinion with the state's decision makers. So I'll stop with that. Thank you.
Okay, thank you. Commissioner Lopez.
Sorry, I just want to add something for people who are watching, so we can thank you for all of your thoughts, Commissioner Howell, but I do want to make a couple of points just so we don't have people that are extremely worried. Sedgwick County is capable of giving thousands between the health department and our community partners and the hospitals and doctors' offices, places like Health Corps, Hunter Health, Guadalupe Clinic. We can give, I mean, I would say if we're getting 7,000 a day, but I mean, if we stretched and did everything possible, I would imagine that we would be able to keep up with that. So we are capable of giving more. The only thing that's stopping us at the moment is just the allocations that we're receiving now. With severe underlying health conditions, I agree. I think that needs to be moved up, and we've discussed that. And so I hope we can see that going forward. And with the 18%, this is just from my understanding. When we had that conversation with KAC about that, and they said Kansas was getting 80,000 doses, I heard after that was incorrect, and we were only receiving 40,000, which would be pretty close to 18%, I believe, from what we've been receiving. Now, as that goes up, I think we need to know when Kansas is receiving more, so we can ensure that we are continuing to get the correct amount. But I just want to make sure that anybody watching doesn't think that we can't give the doses as we're getting them in, because Sedgwick County as a whole is capable of it. Thank you.
Thank you, Commissioner. The county, to say that the county does not have capacity is wrong. We have tremendous capacity in this county, not only through our mega site, but the future of this vaccine is going to be soon doctors' offices and clinics, pharmacies, Kroger. They will all have, when they get more vaccines, more people will be vaccinated. We continue to think that the mega site is all the vaccine coming into this county. That is not going to be true in the future. We are going to get soon to a point where people will have all kinds of choices if they're in a phase 2 status to go get vaccines. That has to be the future to meet the president's statement of having everybody that wants a vaccine to have one by June 1. So that we are anticipating that future. We are prepared for that future. Our partners are prepared for that future. It is all about getting the vaccine right now. So thank you for bringing that up.
Okay, thank you. Just like to repoint out, Commissioner Howell mentioned it on the screen. You see what he was referencing to in phase 2. Obviously, the teachers, we know they've been accelerated. So, as was pointed out, they're not in any order at all. But large-scale aviation manufacturing plants, well, I know we're in conversation with their large manufacturing, and they think they've got some plans. Transportation workers, whatever that means, and then all these workers in the following industries, if they regularly need to be in high-risk settings. So look at all that: retail, warehouse, sales, agriculture, supply of critical services or materials, postal service, Department of Motor Vehicles. So I think what Tom has referenced is they're going to have a meeting. We're assuming that 65 is going to be in the near future, right? And we're going to get the teachers done. So 65 and over will be the next tranche of vaccinations, and that might be a couple of weeks of vaccinating.
25,000 people.
25,000 people.
70.
So I think they have a little bit of time to plan and have, I know Dr. Menz he relies on a number of sources, KDHE, federal, some other studies, and the local medical community. And I know that then he takes the input from, I have trust that Tim and Tom relay our concerns. And as pointed out, I guess anybody can make a motion to say, for instance, agriculture should be next. And if it gets 3 votes, then agriculture's next. If we want to get into that. I personally trust Min's sources of information and his priority. And if he says that we take a percentage of this towards that and a percentage of this towards open field for everybody to do it, it doesn't matter to me. I'm okay with the analysis that gets done and the recommendation that comes back from him. So, but that's a large group that's after 65, after we do 65 and over. So if we want to take emails from any one of those groups and say, well, because I got 3 emails from this group, or I got Facebook stuff on this group, so we should make that the top, then I think we're in an area that's a little bit out of the expertise lane that we're in, other than we serve our public, for sure. So I recognize that. So that's my comment. Commissioner Cruz?
While I would like to be in the meeting on Friday, I have consistently supported Dr. Menz and our medical community. One thing that I would like to, just for my own knowledge, to understand how they're coming to those conclusions. So, if we aren't able to be in that meeting, I would like to know how they came to whatever decision they made, just so that I'm able to relay that to my constituents who want to know why this decision was made and how they came to that conclusion. So if I'm not able to be in that meeting, understood, but I want to make sure that we do get a detailed explanation as to how those decisions were made. Additionally, I think that we've talked about this is when we do talk about those folks who have comorbidities, having, I don't know if it's a doctor's note or if we could partner with physicians' offices to distribute those vaccines as, what did you call it, a POC? Is that what you called it? I don't know where I took my notes.
POD, point of dispensing.
POD, excuse me. For the point of dispensing, like how are we working with our physicians here in town locally? Because they would be the best ones to know out of their patient population who would be the highest risk if they did contract COVID. So I'd really like to be able to make sure that conversation is had and that relay that to Dr. Menz and our physicians' offices, if you could make sure that happens. Thank you.
Let me make, when Dr. Menz made the decision back in December, January, that 65, that elderly should be first, he based that on mortality and the seriousness. He looked at the hospital population, and as you are all aware, when I provide hospital numbers every week, the majority of people are above age 60. So he looked at, that's his justification for developing that particular policy.
Sure, and
As we move-
if I could just interrupt you for a second. I understand that completely, but if there is a reason why he wouldn't say put comorbidities in front of law enforcement or whatever, and I'm not suggesting anything, I'm just saying I would like to know why
Yes.
that justification is made,
Yes.
so when I receive a lot of emails, I can relay that. And I can support those decisions being made because, as we've all stated, I don't have a medical degree.
When he comes back with a recommendation, he will justify to you based on what he hears within his circle of doctors and medical community. For example, if agriculture, as Chairman brought up, they come first, he will articulate to you why they should be first. And it may or may not settle with you, but he can only give his opinion.
Sure.
And then the commission, as we know on all stretches of this, can go in and modify if the body deems it so. So he will come back with a justification for that.
Okay, thank you.
Commissioner Lopez?
I just have one more question. When we're looking at what Dr. Menz puts out, if there is a want for change, and I'm not saying that that's going to be the case, but if that's possible, is there a way to compromise on that where instead of saying one group's going to go, we can say this group is still going to be top, but if there's 3 that want another group to go, they can umbrella under the same thing and say anybody in these 2 groups can go just as first come, first serve, because everybody's obviously not going to want one, instead of changing his orders. Does that make sense?
One of the things that we know for sure is that each of these groups has different numbers in it, and so there may be times that we roll 2 or 3 different
Okay.
categories together because numerically it makes sense that that's because we know what kind of throughput we can get, we know what kind of throughput we can anticipate from our partners across the community, and so we may say these 3 different industries are next, or that sort of thing.
Yeah, perfect. That's what I wanted. Thank you so much.
I'll just add on that, Dr. Menz is been very compromising throughout this entire stretch. I think he would welcome any type of, any comment made from commission. I think he takes a look at it, and he would be, I think, willing to compromise however the commission wanted to compromise.
Okay, thank you. And I mean, I completely trust his judgment on this. I know he's working hard on it, but just thinking if that were a possibility that happened, you know, how could we kind of meet in the middle and not just throw out what he was wanting? So thank you.
Okay, I don't see other comments. Thanks, Tim. And thanks, Commission, for a very healthy discussion.
Okay. And then staying moving here, Chairman. Chris Duncan and Mike Elpers are Zooming, and they're going to put up this model. I want to just go back in time. Commissioner Cruz asked, you know, it seemed like years ago, but it was just about a month ago, some type of visual model that we could create that would let people see kind of the length of this process. So we've been, as we got in time, Chris has done the lion's share work on this, and Mike. We've been playing with this model for the last couple of weeks, and this, let me qualify going into this, this is not a done deal. This is a draft. There's a lot of things you can do with this model, and I want to talk about it. We has 3 proposals for you, or 3 different kinds of models for you to look at. One is, and basically we talked about this in the form of a math story problem, like we all got when we were kids, and here's the story problem. There is a community with a population of 400,000 people that needs the following vaccine with the following stipulations. Bullet 1, each vaccine must be given twice. Vaccine A, shots have to be spaced by at least 28 days. Vaccine B, shots have to be spaced by 21 days. The second bullet is, build a model showing distribution, let me talk here. Build a model showing distribution based on various amounts of vaccine being received to show progression of how quickly the vaccine can be distributed to this population. So there's the story problem. And Chris has taken the story problem and has come up with the skeleton, and there's 3 moving pieces on this board to pay attention. He's going to roll an example, and you're going to watch a graph move. So that's the first piece. Underneath in that box to the bottom, that little rectangular box, is a narrative description of what it is you're seeing as this progresses, which can be changed and modified however we see fit. However, Chris can modify this any way that we want it to be modified. And then on to the right-hand side is a little thermometer-looking thing that will show you percentages of vaccinated population to answer the story problem. So what I had Chris whip up today was a scenario that has 12,000 vaccines coming into the community. This is not county vaccines, this is community vaccines, because that's the race we're in here. It's more than just the county, it's what pharmacies can do and hospitals can do and all of our partners out there. So I had Chris put a model together that shows how fast this goes if we get 12,000 vaccines a week.
Is this first dose? These are first doses.
It's factored in first and second dose in the
Okay.
model. So if we get, as a community, we get 12,000 vaccines a week, he'll model it out for you.
Okay.
The second model he'll show you is if we get 24,000 vaccines a week, and the third model he'll show you is 36,000 vaccines a week. And he'll play this through. So I'm going to have him run example 1 first, just so you can watch it move, and then we're going to run example 1 again after you get the breadth of what we're doing, and then we'll run both of the other examples to show you. And then we'll talk about some of the things this model can do. Did we pass out demographics? Yeah. The demographics we're using for phase 2 is what Kate's handing out, and this was achieved through the planning department, health department, and Jeremy Hill at WSU, best we can tell. These are approximate numbers, and we can begin to build into this model those populations of those subgroups, depending on when Dr. Menz or when the Board of Health determines they should come within the flow. So there's a lot of things we can do proactively with this. So with that, Chris, run the first model here and let them see what it looks like. This is 12,000 doses per week for infinity here, basically, until we get through with the vaccination process. And it takes about 30 seconds to roll through.
And what is that line along the bottom there? Dates?
Dates.
By the month or
Yeah.
by a month? Okay. So there's
Education
1,
group
2, 3, 4,
begins.
5.
Now we're in July, right?
July this
July.
year? We're in July this year?
Yeah.
Okay.
Then September, right?
Okay.
Okay. Your eyes must be better than mine.
A little closer.
Okay.
It's October. January 22.
Is 75% fully vaccinated.
First doses are in May 22.
Okay, so there's the model running through. And if we only got 12,000 vaccines from now through the rest of this, what are we into? May of,
22.
sometime next year, right? It's tough. It's going to take a while.
So those are federal doses that are coming in, or those are just state doses, or those are all doses?
All doses.
Okay,
All
from
doses.
all entities?
From all entities,
Okay.
okay?
the model for 7,000 a week?
We can, it'll make it even longer, yep.
Of course.
But to talk about this, now the county is getting 7,000. We know pharmacies are receiving some. We've heard, like Kroger, for example, said they're going to get 1,000 a week. We know that Grace Med's going to get some. The problem, the challenge in running this model is we're trying to summarize, reach out to all these partners and determine what the total community vaccination rate is. And that's hard to do. But we are already, we use 12,000 because I think just roughly guessing, that's probably what the community is very close to receiving today. And I don't think that we'll ever go backwards. In fact, we should begin to see more vaccines flow into the community, and we can adjust this real time, on the fly, to whatever it is by the week that we are getting as a community. So, Chris, I don't think we need to see this one again. Take us to the second one. This is 24,000 doses. And where you see that little blue highlight come up, that's where we would begin to put in, for example, teachers, public safety, aircraft workers. You could begin to put in these subgroups in the order that we anticipate they're going to get the vaccine, and it would show them an approximate week and month when they could expect to be vaccinated.
That's May of this year, phase 2 complete. Phase 2 fully vaccinated in June.
You have July, that's July, right?
That's July, yeah.
All
First
doses.
doses,
What is that, September?
September.
Okay, October.
So it's October, if we go 24,000 doses per week as a community, we would be fully vaccinated. This is 100% population, 400,000 people by October of this year. Okay, so you can see you increased vaccines into the model, shortens time. Run the last live graph, Chris. And this is based on 36,000 vaccines per week.
And what's our capacity per week?
As a community? I mean,
Is it 36,000?
I think if we had all community partners involved, Ascension via Christie, all pharmacies,
Okay.
we could probably get there.
Okay.
I'll let Adrian or Tim chime
I just
in on
want
that.
to be
but we-
realistic, I mean,
Yeah. Well, this is just a number. It
Right,
could be,
right.
do we really think it's going to be 36,000?
yes, it's going to be.
Hope so, because then we're done. When is
Fully
that?
in August.
Yeah.
In August, 100%. Now, there's two things we know here. 100% of the population is not going to want vaccinated.
Right.
In reality, it's about 75% probably. And we're doing well if we're there. So that's why he puts in there 50% and 75%, because those are more realistic numbers of vaccinated population. But just for the modeling purposes, he's shown 100% vaccinations. So the goal with this moving forward would be to look every week what we are anticipating the community to get with vaccines, modify the model, and run it out. And then also a critical piece of this would be to have Dr. Menz give us guidance and have the Board of Health give us guidance on what groups or what combination of groups should receive the vaccine in what order. And then we can build that into this. And then if I'm an agriculture worker, or I'm a police officer, or I'm any of these list of groups on there, I can look at that and go, okay, this is about the week and month that I'm going to look at getting a vaccine. And I will just tell you that no matter what model you run here, everybody can't be first. This is going to take weeks and months to do this. We have to embrace that. We have to understand it, and hopefully get the people to understand that we don't have enough for mass vaccination, even at an accelerated rate of 36,000 per week. It still takes several weeks and months to get through this process with 2 shots going. So that's the goal of this model. If you hate it, we don't have to use it anymore. If you like it, we can continue to work on it and modify it. And someday, if the commission approves, we'd like to put it on the website. And then Chris has put up the final 4 slide here, which just kind of talks about the differences. And we're going to send this to you so you can use it on your laptop as well and get you hard copies of this. But it just shows you the differences between dosages or how many vaccines we get per week and what it means for the community as far as when we can finish the story problem and get 400,000 people vaccinated. So,
All right, good stuff.
okay.
Here's Commissioner Howell and then Commissioner Cruz.
Just a clarification, so on this tool, it's using the number 400,000 as 100%.
Yes.
I understand that 80% of the people, or 75% of the people will want this, maybe 25% won't. That's
Right, yes.
rough numbers. Where's the $400,000 person number coming from?
That is the population of the county subtracting those under the age of 18.
That which brings up a good question. Do we know whether or not there's a time in the future that they're going to also be vaccinated at some point?
Children?
Those below age 18.
Well, first of all, one of the vaccines now can vaccinate over 16, and it's Moderna. I think, Tim, are you here yet? Moderna a 16 or 17-year-old can be vaccinated with Moderna. It has to be 18 and above for Pfizer right now. That number is not, we stopped at age 18. So there's a few 16 and 17-year-olds that could, under the current policies of the vaccine, receive Pfizer. Vaccines for children is being discussed nationally right now. And as that rolls, we can change this model, create a model, add them to the model, and simply make that number from 400,000 to 512,000.
I do think it's important for people to understand we're talking about 400,000 as our maximum 100% number rather than the 512.
That's the adult population of the county.
Yeah, and then the second thing I would point out is as aggressive as that steepest line is on that chart there, that actually is not quite as steep as the national headlines are indicating. You know, we're talking about, 600 million doses by the end of July. That's actually more than 36,000 per week to Sedgwick County for us to make that goal. So, again, I think that's a good number for us to plan towards. 36,000 is a nice number for us to plan towards. We ought to have a plan that would actually be able to do that at some point. So,
Well, there's always the possibility, we've talked about this, if we start getting a lot of vaccine, we run an outdoor mass vaccination at the ballpark, or an outdoor mass, and do 50,000, 30, 40,000 in a day. I mean, there's strategies for that. It's just been moot because we haven't seen near the vaccine numbers to pull that kind of thing off. But if the floodgates would open wide open, we got some ideas.
did you say these numbers came from Jeremy Hill?
The business numbers did. Planning department gave me demographics of the county, and the health department also gave me some demographic numbers of the county. And I will qualify again that when you look at that, those are our estimates. It just gives us a ballpark figure of the kind of population that we're looking at. And Kate handed me a note, I misstated. Pfizer can be given to 16-year-olds and above. Moderna is 18 and above, so my bad.
And I think there's some overlapping demographics here. I want to make sure that, folks that are 65 and above might be in these other categories as well. So it might be double, I don't know if they're double
Absolutely,
counted
sir.
or not,
Yes.
but okay. All right, thank you.
Okay, Commissioner Cruz.
Thank you. The other sort of kink in this would be, did Johnson & Johnson get their emergency approval yet?
Not that I have heard. Tim, do you know? Or Adrian, I don't know if she's still on the phone.
So when that happens, that's a one-shot
Yeah.
dose that could even speed this up a little bit more. But
Yes.
I'm living in best-case scenarios here. I really can't thank you guys enough for getting this. Looks way better than my lines that I had in the conference room over there. But I think the whole premise of this was to give the community an idea of just how long this could take. So when you see news reports that say we're getting X number of vaccines per week, and there's so much information, at least maybe we have an idea, provide a peace of mind to those in our community, maybe have an end date in sight. Now the May of 2022 is not all that great, but I do think this could alleviate some real concerns and anxiety for folks in our community if we just know how much longer it might be until the whole community is vaccinated. So I really appreciate the work that's gone into this. You said Chris Duncan?
Chris Duncan,
Chris
and Michael
Duncan. So
Bruce.
thank you, Chris, for that. I'm excited to be able to share this with my constituents. People have been asking for this, so I'm thankful that this is ready to rock and roll. Hopefully, maybe if we see value in this as a commission. So thank you.
Commissioner Howell?
Thank you. Just another point I'd like to question, at least understand a little bit more deeply. But Jeremy Hill also, when he presented some of the trend lines and things that are going on in this community, it was a great presentation. But he also had a slide on there that said it would be herd immunity in September of 2021. That was buried in the slides. Can we please understand that more deeply? Where's that coming from? And is that valid, or is that?
Last I checked, Jeremy's not a doctor of medicine or an epidemiologist. I think that Jeremy is a consumer of data, and he reads a lot, and he's looking at the same national news we're looking at, where everybody's guessing about, and I think Commissioner Dennis brought this up, we're all guessing about herd immunity right now. We're all guessing about effectiveness of vaccine. We're all guessing what's going to happen with kids. There's just still so much that science I don't think understands. So I think Jeremy puts that into his document based on things that he's read.
He had a reference on his slide. It says CDC Moody's Analytics. I'm not familiar with that, but that sounds believable if it's a CDC-based source. But they also show that Kansas is far behind the rest of the country as well. That's still part of that data.
With
But
vaccinations.
this is about herd immunity. And it talks about the percentage of shots administered, and Kansas is way behind the entire. Well,
Yeah,
it's one of the worst states in the country. But
I mean, the state's putting out things every day on this data thing, and Dr. Nielsen is working to rectify that. There is the latest that we've gotten on that. Seth's not on the phone call here, and we have an advantage here in Sedgwick County because we have Seth Conkle that's consulting for us, and he's also consulting for state of Kansas, so we feel like we have pretty good conduit there. There is some type of interpretive problem between the state of Kansas and CDC data that's causing this, and they're working on that. They're cognizant
so
of
let
that.
me wrap up my comment. I think somebody needs to understand that slide a little bit deeper. I'm not asking for anecdotal comments. I'm asking for us to understand what they're saying there, so that we can understand it. You know, what's the basis for that slide?
On
I think
herd immunity?
Yes, I think that's a very important thing for this community to understand, because herd immunity, in my opinion, is a trigger for differences in health policies, for example. So I think we need to understand that more deeply. The fact that he presented that to me is very noteworthy. But I think rather than just blow past it, I want to understand what's behind that slide. So I think someone from staff ought to.
We'll touch base with
become an
Jeremy to
SME
try
on
to
that slide.
interpret
Thank you.
that. But I will tell you that doctors, Fauci, and Dr. Mins have all been saying very early on that we get around the corner on this when we get enough vaccine out and enough normal herd immunity, that now it does change the public landscape of how we can live our lives. I don't know that they have it down to September of this year. I mean, it could be June of this year. We don't know. But I'll get with Jeremy and try to interpret what he meant by saying that.
Well, again, if the administration is truly able to determine they're going to get that second dose out to everyone by the end of July, then that actually makes a lot of sense. So
Yeah.
it all depends on whether they can really do what they say they can do.
Commissioner Cruz?
Thank you. Well, I just want to make sure that we're being clear. This graph is just vaccine doses in people's arms.
That's correct.
It's not anything about herd immunity. So I want to make sure that there is a difference. I mean, I get it that when we do get to a certain point of people being vaccinated, that we could see herd immunity. But this is for every person who wants a vaccine, up to 400,000 people in our community to be vaccinated. So I just want to make sure that there is a distinction made between what this graph is and what Commissioner Howe was just talking about. Thank you.
Commissioner Lopez?
When it comes to herd immunity, I saw that Dr. Fauci was saying anywhere between 75 and 90% of people need to be vaccinated to get to that point. I know with different vaccines that we already do, it changes, it fluctuates between each different virus, so we don't exactly know what percentage it's going to be for this one in particular. But what does that look like if Sedgwick County can't get 75%, say it ends up being 80% is what we actually need to get to herd immunity? What does it look like if we can't get 80% of Sedgwick County residents to want the vaccine?
Well, I thought I had you tell me just the last part of the question again. If we can't get to the 80%?
Not because we don't have the doses, but people don't want the vaccine. So if we only can vaccinate 65%.
Well, I'm going to put that on the list for Dr. Mintz to talk to. I think that you'll hear them say that if we can't get a majority of this population vaccinated, we're going to have this virus around for a long time. So the higher the percentage of vaccinations, the better. And I think that's all of our job as people involved in this. We should promote this. And I think that we have plenty of people that want the vaccine right now, clearly. We've talked a lot about it. Everybody wants to get it ASAP. I think there's going to come a time in early summer where we're going to be really trying to promote people to get the vaccine, because all will agree that the more percentage of your population that gets vaccinated will help to diminish the virus. So if we don't, I don't know what that number is, Commissioner, if it's 75 or 80%. I don't know. All I know is what you've read, and if you watch Fauci, he's going to tell you 3/4 of your population needs to get this vaccine. Otherwise, it's going to be a tough situation. So I think that's our immediate goal. We'd love to have 100%, but we know that's not realistic. So we'll try to get some data on that and have Dr. Mintz or Dr. Ebersol or Dr. Antonios talk to that.
Okay, thank you.
Okay, I don't see any other questions. Thanks again for everything.
That's all for this, sir, and then the one legislative item that shouldn't take very long. Sorry to take you so much time this morning.
Good morning, Commissioners. Akeem Ashford, Communications Director. Just here to provide you an update. House Bill number 2233. This is going to be in the Committee on Local Government. Essentially, this bill will be known as the Municipal Historic Buildings Act. We've got you some copies here for your update reference. This bill basically says that no city should be permitted to essentially sell, destroy, demolish, dispose of, otherwise alienate a structure that's more than 80,000 square feet that is also put on the National Register of Historic Places without first obtaining the approval of such sale, destruction, demolition from basically the general public through a vote. Chairman, you sent an email. I guess there's a letter that has been sent around here in the city. There are several people who have signed on: Downtown Wichita, Greater Wichita Partnership, Visit Wichita, Wichita Community Foundation, and the Chamber. And this letter is basically an opposition that will be given to the Committee on Local Government, essentially kind of outlining the reasons for the opposition. The number one reason that's stated in this letter is that this is a local issue and should be decided by local elected officials and voters. It also goes on to talk about the Riverfront Legacy Master Plan and how the city of Wichita and in the private partnership is already pretty much doing such thing, eliciting comments from voters and people in the community. So that process is already happening. So, allowing that process to kind of continue to happen here locally. It also talks about the two buildings that we're essentially talking about here, Century 2 and then the old Wichita Library. That's kind of what we're talking about, and that this bill would really aim towards addressing. So with that, I think, Chairman, you've been asked to sign commission has been asked to sign onto the letter in opposition of House Bill 2233. I can tell you there actually will be a hearing tomorrow in the Committee on Local Government at 9 a.m. So that's kind of the future part, and I'll definitely watch that. I don't have any other comment unless Tom or Mike wants to add in, but I'll stand for any questions that you may have.
Go ahead, Mike.
Yeah, Mr. Chairman, I was just to follow up on what Akeem has just stated. We were approached to see if we wanted to take a position on this bill. I will say, though, that the hearing's tomorrow at 9 a.m. It's too late to submit written testimony. I mean, if we want to weigh in some fashion, we can. We can sign off a letter, or we can send a letter from the chairman to our local delegation or such. But as far as getting testimony in, we were approached a little late by this organization or this group to be able to present testimony.
Okay, well, anybody can comment? Personally, I'm in favor of joining with this group to oppose this legislation, but and leave the decisions locally. And if it's the majority of the commission feels we could do that, then fine, and if not, then we can pass. Commissioner Cruz?
Thank you, Chairman. I have a question. Okay, so in line 12 of the House bill, it says, well, leading into it, by a majority vote of all the qualified electors of such city voting in the next scheduled general election. So this bill is essentially saying that before the demolition or the sale of a property, it has to go to a vote.
Yes.
So how is that a bad thing? I guess explain to me why we would, how it wouldn't be local control if we are saying to put it to a vote
I guess
of the public.
if I was arguing the city side of this issue, or even the county side, would you want our hands tied on every building in this county or buildings in this county to always go to a vote if we decided to do something with it, destroy it, demolish it, sell it? I mean, we sold the Coliseum, actually didn't go to WSU, but it's being used by WSU right now. I mean, that's the issue. Are our local elected officials wise enough to make decisions regarding their property, or do we need every such action to go before the voters? Now, it would have to be put on the historic register, so that's a little bit of embellishment, but I think that's the issue is should these kinds of questions always have to go to the voters, or are our elected officials wise enough to make those decisions?
I guess receiving this information last night, I really haven't had time to really chew on this. I don't know that I support or oppose. I don't know that I really want to take a position. I think that I need some more time, apparently, to make a full decision. So that's kind of where I sit on this, just because we did receive this last night. So it's a little quick for me. Thank you.
Commissioner Howell?
Thank you, Mr. Chairman. I think it should be noted that 135 of the 165 legislators in Topeka don't live in Sedgwick County. And I don't know that we ought to ask them to weigh in on something that's very highly political for this community. And I think everybody understands how highly political this is. Very political. In fact, I think Commissioner Lopez, this is a big part of your last campaign between you and your opponent. It happened as if this is the issue that you should or should not vote for a particular county commissioner. And the entire time that was going on, I have said over and over and over, this is not a county issue. This is a city issue. And as much as I'd like to show support to the people on the back side of this, I support Greater Wichita Partnership. Please don't doubt my support for you. Visit Wichita Community Foundation, support them all. Regional Chamber of Commerce, very, very much support what they're trying to do downtown Wichita, and on it goes. But I also have lots of friends who support the other side. And I don't know, I want to get in the middle between these folks. The reality is, this reminds me of a spat between children when they go to their parents and say, please solve the spat. honestly, I don't know that we ought to go to the legislature for this. This is not the right way to solve this. In fact, please clarify, Mr. Papoon, did the city not already indicate that they would already go to a public vote if they chose to do something with this building?
You know, I've been following it, Commissioner, but not that closely. I don't know if that's been said by the mayor or the city manager or not.
I think in this letter, if I can add, it's the second to last paragraph. On August 18th, the city of Wichita voted unanimously to approve a new policy that requires an advisory vote of the citizens of Wichita prior to demolishing, leasing, or remodeling Century 2 in the old library.
So again, that answers the question. So thank you for the clarification, but I think that they've already said they would hear from the people on what to do going forward. Now, it wouldn't be a binding vote, but it would certainly be an advisory vote. Again, I don't know, there's a whole issue of whether you can even have an advisory ballot question. I think that's potentially questionable in Kansas law, but anyway, I guess my point would be this. I don't feel compelled to get involved in this. Those folks that already signed on to the letter, I support their right to oppose this. And I just don't want to get in the middle of it. I don't know that it's the proper role for a county commissioner. In fact, I live in Derby, and I don't know that I should be getting involved in this. And as a county commissioner, is this the proper role of Sedgwick County government? I don't think we should get involved in it. So I would rather not issue an opinion as a proponent or an opponent. I think it's just it's inappropriate that we get involved in this at all. Thank you.
Commissioner Dennis?
Thank you, Mr. Chairman. If we go back in time when this entire idea of the East Bank development came up, the leadership of that group came to Sedgwick County and they asked if we'd like to help fund that study. And being great partners with the city of Wichita, we did partner with them and we did contribute to the proposal. And eventually a study came out of that. As a result of us contributing to that, we actually had one of our county commission members sit on the board that finally made the final decision. During that entire period, I've always kind of stayed on the sideline because I kind of agree with Commissioner Howell that this is a city issue, it's not really a county issue. And I've just been waiting for their decision on what to do so that we can, again, remain as partners with the city of Wichita. With that said, I do have some concern with this bill because it has the legislature in Topeka, which is not tied to Sedgwick County or the city of Wichita, making a decision on the future of Wichita. And I don't think that's appropriate, that they tie the hands. I spoke to this last Friday when we were talking about the budget, that I don't think it's appropriate for certain groups to tie the hands of other leaders so that they can't make decisions that are in the best interest of their public. And in addition, if you look at the letter, they have, this letter does stipulate that it will go to a vote of the people. The commission over at Wichita City Council has already decided that they're going to do it that way. So I'm kind of on the fence on whether or not that we should get involved in this or not. But if I just look at the fact that we're going to ask a number of legislators who have nothing to do with this area to make a decision on the future of this area, I think that's absolutely wrong. And so I'm still not saying that I would approve a sales tax or anything like that going forward to fund this, but this is a different question. This is, should the legislature tie the hands of local government? And I'm opposed to that. Thank you, Mr. Chairman.
Commissioner Lopez?
I think I would agree with Commissioner Dennis on just about everything he said. I mean, I can see the pros and cons of both. Is this going to the city of Wichita to have them sign on to this? And if so, do you know what
I am not
where
sure.
they're at with it?
I think what's been asked, Commissioner Lopez, is whether or not we would support or oppose this legislation. And they gave a draft letter that all of these other groups that you have in front of you, which we could easily modify for the chairman's signature, and with just a very small tweak, that we could give to legislators just to show what the county's position would be on this. And I heard back from Jason, even though it's too late to submit testimony, he could distribute this letter to the committee members after the hearing, so they'd still know what Sedgwick County's position would be, so.
And would our position make much of a difference since this really isn't a county problem? Would us saying yes or no that we agree how much does that factor into their decision on if they pass this or not?
You could probably ask that question for any legislation.
Okay.
And that's a very good question, how much our influence is for these people up in Topeka. But I think it would have more influence on our local delegation than it probably would for as Commissioner Howell stated, there are 130 some House members that aren't really going to care about this at all.
Okay,
So.
thank you.
Okay, so let me ask a question. So if we want to remain neutral or not send anything, in the past, we've had that discussion about some other bills, and I know specifically that Commissioner Howell is on at least once, if not more than one occasion, said you were going to do something on my own. So when he did something on his own, was that on county commission letterhead, that testimony, or was that just a letter from him personally? You know?
I assume that the commissioners use their letterhead, but many times in the testimony, they'll say, I'm speaking on, as a single commissioner and not on behalf of the board, is what we usually do.
All right. So if I wanted to support all of these people in this letter, I could do that
You could do that.
individually?
Yeah. You'd say, I'm
And it'd be on Sedgwick County letterhead?
Chairman Meitzner, and I'm speaking on my behalf only, but I support, or I oppose, this bill.
Well, I'll make a motion that we join in opposition. And if there's a second, we'll make a vote. If there's not a second, then we'll let it go.
Are we able to make a motion at a staff meeting?
A formal vote?
We typically don't take formal action. I think we can,
My apologies.
we can just take an informal vote to determine whether or not the chairman can issue the letter on behalf of the board.
Okay.
I mean, it wouldn't be formal action, but obviously if three commissioners support it, you would feel comfortable sending that on behalf of the commission.
All right.
Let me rephrase
looks
this.
like
Do
the silence says that there's not the courage to do that right now. So let's just pass and I'll support this group. And if anybody wants to support with me, then let me know.
I have a question. If we were to do that with us as the board, is that something we have to say right now? Because I would want to look into this a little bit more before I said either way, honestly.
No, we have time to look into this to whether or not the board wants to take formal action. This is just going in front of its first committee. It would still have to go to the House as a whole. We would have time after seeing what the committee does to determine whether or not the commission wants to take a position on the bill. Then it would have to go to the Senate, and we could weigh in on the Senate side as well. And you'd have plenty of time to review the bill and talk to constituents and think of all the different angles, as Commissioner Cruz had alluded to earlier, so.
Okay. Thanks for that information. Commissioner Cruz?
Thank you. Yeah, I mean, that's where I'm at. I mean, I've just been given this letter, I've just been given this bill, and I just want to make sure that I have all my ducks in a row before I say yes or no, considering that it's my name on this, and so I want to make sure that I have a little bit of time to sit with this to make the best decision possible. So that's really what I'm asking. I'm not saying I don't support it. I'm not saying I do support it. I'm asking for some time to consider supporting it. Thank you.
Okay. Commissioner Howell?
Just as a point that I think Jason Watkins would probably want to share if he was here, but this legislation, if it passes one body, becomes something you can actually combine with other bills in the process of passing legislation. It doesn't have to pass both bodies, believe it or not. You can take this legislation and you can put that into a bill with other legislation before it go, at conference committee. And so if you really feel strongly about this legislation, I would not wait until it goes to the Senate, just a FYI. I think that if you do want to weigh in, you should do it when it's at the first body, because once it passes one body, it becomes potentially something that you'll see later on, even if it doesn't pass the second body. Just a point of reference. Thank you.
All right. Okay, I don't see any other discussion, so we'll catch up with you. Commissioner Dennis.
Thank you, Mr. Chairman. Let's change subject just a little bit. Last Friday, Manager Stoltz presented a possibility, and we did pass it for a disaster resolution by showing you the impact on City of Cheney. Since that time, I've also received the impact on Cheney School District. And with their bill that they're getting for gas usage just during the pandemic, or during the cold snap, rather, their possibility of having to lay off 6 staff members. So as we move forward and have conversations with our legislative body up in Washington, D.C., that's one more data point. Now we've got 2 cities that are in deep financial trouble, and we've got a school district that is in deep financial trouble as a result of this. So I just wanted to bring everybody up to speed on the impact that it's also having on schools. Thank you, Mr. Chairman.
Okay. Challenging time for City of Cheney and what's the other one again? Keachai, yeah. I did talk to the Keachai mayor, by the way, and had a good conversation with him, and talked to one of the city council persons. They're meeting Thursday to try to see. I believe that they can. Maybe you could. I'm trying to steer them towards our, because we did that order, the emergency order for the countywide, that they opens them up to talk more directly to our EOC operations. Is that correct? Anybody know that for sure? I don't see any, but I think that's.
County manager needed to go to another meeting, so he had to leave.
Okay,
And I'm
well,
not
we'll
sure.
fill that in. Okay, but thank you, Commissioner Dennis, for staying on top of this and keeping us abreast. Okay, I don't see any other comments or questions, so we do not have a meeting tomorrow, but who knows, could have another special meeting just to have a special meeting. So, but with that, we'll adjourn for today. Thank you, commissioners, for being available today.